All right, guys, we are live with another coronavirus show. It should be a great show today. Today we're talking with Dr. Rita Ellithorope, and so I'm super excited to hear what she has to say about the coronavirus. I don't really know too much about what she thinks. I've heard a few videos on what she thinks, so she probably doesn't line up exactly with what we believe, but I'm definitely interested in hearing what she has to say. And we're also going to be doing a giveaway today, guys. So at the end of the stream, we're going to be giving away all these different items. We're going to be giving away Fluoride, Poison on Tap DVD. We're going to be giving away the Don't Tread on Us CD. And we're going to be giving away POH toothbrush, the best toothbrush out there. We're also going to be giving away a Fluoride Poison on Tap t-shirt. So, oh yeah, citrus peeler. Oh no, citrus peeler and DMSO cream. So we're giving away all that at the end of this stream.
You're giving away all that stuff tonight?
Yeah.
It's too much stuff. Don't give it all away.
What do you mean?
It's too much.
No. Too much. Do you hear him? No. So we're going to be giving away all this stuff at the end of the stream, and how you get it is you have to either support us on Patreon just for $1 a month, or you can buy anything off of framingtheworld.com, and you'll be entered in for a chance to win one of these things at the end of the stream. And so also, I'm going to have Logan explain this. But if you order, or if you just explain it here,
Okay.
Logan.
So we're having a grand prize drawing at the end of the week. So everyone that supports on Patreon in increments of $5 is going to be entered into the drawing at the end of the week on Saturday for a pair of Orion sunglasses. So these run normally about $150 or so per pair. They're the greatest sunglasses that I've ever had.
Totally.
I wear them, Paul wears them,
Every day.
Dustin wears them, everybody, all of our friends, we all wear them. It's they're promoted by Shane and Rob over in Canada, so they're the guys that hooked us up with these. So we're gonna do a grand prize drawing at the end of the week. Anybody who becomes a Patreon supporter in $5 increments gets their name put into the grand prize drawing. Now, they're $5 increments, so if you become a Patreon supporter this week of, let's say, $20, or let's say you were $5 before, or $1 before, and you bump it up to $5, or you bump it up to $20, every $5 increment you go, your name gets put in again to the drawing. So the more $5 increments you have, the more chances you have to win. And so you can talk about picking up a pair of Orion sunglasses for $5 that will 100% be the best sunglasses you had that you've ever had. And Paul has a handful of these here in the studio. So do you want to let them try and pick out what they want, or do you want to just kind of, this is the pair?
Yeah, so we have a few different varieties here, and so
we'll showcase them throughout the week, and you can kind of decide which pair you like. So.
And also, if you want to pick up one of these pairs of sunglasses, Shane Jantz is the one that sells them. So we got to talk with him and figure out a best way to contact him. But if you want to get a pair of these sunglasses, the best sunglasses on the planet, literally, just shoot me an email and I'll forward it to Shane and he'll hook you up. But yeah, guys, so we're going to be talking with Dr. Rita in about 10 minutes, 15 minutes. So stay with us here. It should be a great stream. I've been messing with different things. Like, for instance, I've been doing like this. Are you ready, Logan? Are you ready to show? I don't know. Let's see how it works.
Look at that.
Oh, man.
We're like the fancy news networks.
So I don't know how it works here, but we got some split screens going on. I don't know. I'm still working out all this stuff, guys, so bear with us here. But until we get it all sorted out, we're going to be just doing simple stuff. So
we got to get Dustin like going across the bottom.
Yeah. All right, well, Dustin's here. Oh, do you have your Orions on?
Yeah, I was like feeling stressed out, and I put them on, and I feel cool now.
Right?
Like everything, my whole world is just, man, it's
just
just
chilled
like,
out.
Oh wait, hold on.
It's like everything like the whole day, whatever's bothering me all day long, just the things that just build up in life, I put them on and they just all vanished away. So you don't even know the real me, because I come in here after a day of work and I take off my sunglasses and then that's who you see. But when I put these sunglasses on, like, this is all my problems just melt away. So you know what it's like, guys. I don't even know why you take them off, but it's just not socially acceptable to just wear sunglasses everywhere you go.
And then, the great thing about the Orion sunglasses, they're not like typical sunglasses where they just dark out everything. And so when you walk into a room, it's too, you can't see anything, it's dark. These actually just change the balance of the light that's getting brought in. So it actually just has like kind of a greenish tint to it. And you can actually 100% wear them inside and not have the same effect where you can't see what you're doing. So when when you're driving and you need to look down at your phone or look down at something in your cab, you don't have that where you have to pick up your sunglasses and look for anything. It's a perfect
and all sunglasses featured in Deported are Orion sunglasses.
That's right.
All right, guys, so make sure you hit that like button and that thumbs up button and like this video. Also, don't forget to subscribe if you haven't subscribed yet to this channel. We're trying to boost those subscriber numbers. So
yeah, make sure to hit that notification bell, because YouTube likes to crack down and kick people off and doesn't like to tell you when we got the show coming on. So make sure you hit the notification bell so you can get to see when we have our shows.
Oh, also, guys, big news. We totally booked Mr. Death. Mr. Death is in tomorrow. Yeah, I called you about this earlier, Dustin, but you didn't answer. But
I called you back and you didn't answer.
But big deal. We got Mr. Death, Fred Leutcher, that is going to be on the show tomorrow. So you're definitely not going to want to miss the show tomorrow. It should be a really good conversation. And if you ever wondered, what's the best way to kill someone? I mean, that's the show.
That's what we're gonna get out of the show. The best way to kill someone.
I think I should probably take these off just so just kind of, I know it makes people uncomfortable because everything in my life is
You're too cool, man. You're too cool.
Because like if you're like too cool and too calm and everything's just going too well and there's no problems at all, and then you show up, it just magnifies everybody else's issues. So I can handle it. So
Andrew Paul from the chat said Dustin looks like he's spinning overnight jazz. It is. You're in with the cool sounds of jazz with Dustin.
I mean, that's what, if you don't know this, if you could watch the radio, that's all the DJs are ever doing. They all have sunglasses on, but you wouldn't know that because it's the radio. That's the secret. They might not be wearing Orions, but that's why the radio stinks,
Yeah.
But they're getting what they can. So we got some people tuning in, so we're kind of lingering a little bit, letting some people show up here, So people like the sunglasses. I don't know. We got a lot of people in the chat. Two Dun, Granite Howitzers here.
Two Dun's there?
Of course.
Oh,
Two Dun's set his alarm. He's he's about to go to bed.
We got Orange Blood in the house too. He's a Patreon supporter.
Orange Blood.
He tuned into our
Sheila Jackson.
The director's commentary for Beyond Jordan that we have on Patreon that we did the other day.
What's up with that shirt, Paul?
What, this shirt?
Yeah, that whole thing.
I'm just being patriotic, man.
Where'd you get it from?
That's a good question. I don't remember, honestly.
Well, Sheila Jackson wants to know.
We do have a video. I don't know if you want to tee that up, Dustin.
Of Dr. Rita or of Mr. Death?
No. We have.
Mrs. McMurtry's video.
Mrs. McMurtry's video.
Right. Yeah. Sorry. Our house is in the house. Yes. Guys, check out our house there.
Make sure to head over there and subscribe to our house.
If you haven't subbed here, then get out and go sub, and then maybe you can come back. All right. So, our friend Mrs. Cassandra McMurtry is the host of Gently Led Sisters, and If you don't really love our show and you like her show better, go over there now because I think she
Are they
should probably-
streaming?
Usually she does at this time, so check her out, Gently Led Sisters.
Well, maybe we should confirm that before we send everyone
Well,
away.
if she's not there, then she's not there. So just open another
right
tab
back.
and check it out. You know, we're not trying to rob all the people. This is YouTube. You can check it out later. I don't know if she's streaming. I'm pretty sure I subbed to her. So, So she made a cool post on Facebook the other day, and she had written something in her blog, and someone had, or a few people, including my wife, I think, even said, hey, why don't you make this into a video, I guess. So I don't know exactly how that went. Tomas Romanos says, Dustin is not a good interviewer.
Well,
Okay.
that is rough.
I know.
Can we put this guy in timeout?
I
No,
guess-
that's okay. I can handle that. Let me just put my
Look,
sunglasses on.
Dustin's doing a
He's
great
too-
job. Like, a lot
he's
of people,
too cool.
a lot of people have a
go
lot
back to
of
Dustin. Show how he's too cool to handle that.
I can handle that.
He doesn't care about that
I
comment.
don't know how to do it with my headphones on. Too much happening, but it feels good.
Look, it's a lot of pressure doing these
Oh,
shows.
okay, he recanted. He says,
Oh,
but
man.
Dustin is
Well-
cool. I just can't interview. I can live
let's
with that.
put him in timeout.
No, I can handle that, man. We're cool. I can live with that. That's,
Hey,
that's
Thomas.
honest.
You're on a tightrope.
Yeah.
All right.
So Mrs. McMurtry from Gently Led Sisters made a cool video. It's only a few minutes long, but she's narrating over some video clips that her son had put together. So if we can play that, and it'll be her voice, and she'll be telling you what she wrote in her blog. So let's see this.
I feel like I am in a dystopian time era every time I go out. I hear phrases played on a loop inside the store, and I am herded like cattle. 6 feet apart, social distancing, we're all in this together, my new trigger phrases. At one place, my temperature is taken before I'm allowed to enter. There's
I'm not sure what happened there, guys. But it's not playing.
Talking.
What?
Just somebody says, it's dark.
I
Pop.
see men in the streets.
It's dark. Pop.
All right, technical issues.
It's dark. So, if you guys don't know, that's from Little House on the Prairie when Mary goes blind. It's not funny. It was very
It's not
touching.
funny.
She was blind.
That was traumatic. I remember that as
Yeah.
a child when that happened.
Hey, yeah. So, what do you want to do? You just want to pull it up on another channel here?
Yeah, pull it up on the Facebook. Do you have your mic in? I just don't get it.
I feel like I am in a dystopian time era every time I go out. I hear phrases played on a loop inside the store, and I am herded like cattle. 6 feet
Good
apart,
times, guys.
social distance.
Yeah. So,
All right, well,
cool.
we'll get it later. We'll get it figured out, guys.
yeah, I don't know where that would be. I'm looking on her Facebook. It's not there. So,
No worries.
that's cool. So we're gonna have Dr. Rita Ellithorope. Sorry, there's a lot of letters. Dr. Rita Ellithorope's going to be with us, joining us in about 10 minutes or so. We're going to get her on the video Skype, and I'm going to botch the interview royally, but nobody's really going to care because it's her job to be interesting, and I'm just here to kind of, just open the door to Dr. Rita. So I'll give you more of an introduction, but I'm going to read this whole thing. Dr. Rita Ellithorope received her medical degree in 1982 from the Chicago Medical Center in North Chicago, Illinois. She then completed her residency in family practice at Womack Army Hospital in Fort Bragg, North Carolina in 1983. Did you just pull this off of her webpage then, Paul?
Yes.
Okay. She relocated to Fort Knox, Kentucky, where she served as an emergency room staff physician, general medical officer, and flight surgeon as chief of the aviation clinic from 1983 to 1990. Dr. Ellithorope received a second doctorate in integrative medicine from the Capital University of Integrative Medicine in Washington, D.C. As a guest faculty member at Capital University, she continues to teach anti-aging medicine and natural hormone replacement therapy for women and men. She is a diplomat of the American Board of Anti-Aging Medicine, as well as the founder and medical director of Tustin Longevity Center. Her research on oxidative stress and anti-aging has been published in several peer-reviewed journals, and she is a nationally recognized speaker on these topics as well. She participated in cancer investigations with Dr. Stanislaw Brzezinski at his research institute in Houston, Texas, and was later published as a co-author in literature describing his unique therapy. She is a staff physician and the director of women's study at Whitaker Wellness Medical Clinic in Newport Beach, California. She has helped in the development of natural medicine therapies at the Great Smokies Medical Center in Asheville, North Carolina. With a determined commitment to her patients' nutritional road to health, she regularly reviews treatment modalities and documents the results. She shares the documented research of successful interventions in peer-reviewed journals to help further educate her colleagues on the benefits of certain treatment modalities. Dr. Ellithorope provides a practice rooted in a fundamental approach which integrates the best of standard Western medicine with effective natural therapies. So, integrative medicine, I don't know exactly what would be considered integrative. Maybe that's a good question. Does anybody know what integrative medicine is? So we're going to have her on the show, and she's going to give her point of view on the coronavirus and what she understands. And if you guys have any questions, because I will play this comment to the max about how I am not a good interviewer. Thank you very much. I really appreciate that, because it kind of gives me a good cop-out. So I appreciate that. That was a very friendly thing to do. Where'd that guy go? What was his name? Thomas Romas. Yeah, so Tomas, thank you very much for giving me the ability to use that as a cop-out. So, because I'm not a good interviewer, I'm going to have a hard time getting these questions right.
He's going to ride this one all day.
What's that?
I say you're going to ride this one all day.
I'm going to ride it forever. And if it happen to work out, then I'll just...
So someone from the chat had a good idea that we should actually premiere the video of Mr. Mercury after our interview with Dr. Rita, and then we can get her to call in and commentate on it.
Yeah,
so
and I got it working, so.
So after she does her show... It's
only 3 minutes. Let's do it twice. We're cool. We can do it again, because there'll be people later.
Cool. All right.
If it works, let's see it.
We'll just do it live.
Let's do it live.
All right.
Let's see it, Paul.
Roll that beautiful bean.
From day one, I was upset about the Constitution being upended. I was not okay with it, and I felt like we needed to stand against it. But as time goes on, there's a new side effect of all this emerging, and that's how our culture is changing. We aren't looking at people as if they are people, human beings created in the image of God, our friends, our family, our comrades. We are looking at them as the disease-carrying enemy. What if they are carrying the virus? What if they are asymptomatic and they're going to kill our entire family? We must stay away from the people. Don't get close because they could destroy us all. We flee from human interaction. We isolate. We refrain from touch. And it's not a good thing. The longer this goes, the more this will become
They did a really good job on that. Miss McMurtry did, and so I really appreciate them doing that. I totally agree. There's another video that we're gonna play at the end of the stream tonight. That's like 12 minutes long. It's a longer clip of this guy in Payson getting arrested. Did you see that?
Oh, in Winslow?
Yeah.
Yeah. He tried, basically, from what I've heard, is like he was, he had like an antique store, like he sell the Indian rugs and stuff like that, like a tourist spot. And he was trying to make his store essential. So he was like, basically started selling like candy bars and water, because if you sell food, you're an essential business.
Yeah.
So he tried to
So we're
get
gonna
around
play
it.
this video later, because it's if you haven't seen it yet, it's pretty powerful.
Yep. Just trying to do what he can.
I know.
Trying to stay open.
Trying to
There's not much going on in Winslow. I've been there.
You even said like only a couple people came in.
Yeah.
Oh man. Well, Crystal Wallace, thank you so much for upping your Patreon support. So we got you down. So right now you're looking good to win.
Is she the first one
yeah,
in?
She's the first one in.
All right.
So if you guys want to be entered in for a chance to win one of these DVDs, CDs, T-shirts, the DMSO cream, and later on in the week we're going to be giving away the Orion sunglasses. Make sure to support us on Patreon, or just donate. You can donate to Framing the World, donate to the show. It all counts. So
Are you sure you want to give away all that stuff?
Yeah, we're doing it.
Seems like a lot of stuff.
We're doing it, man.
Okay.
We're doing it.
Are you going to give it all the way to the same person?
No.
Spread it out?
Spread it out.
the
We're
love?
gonna spin that wheel. I think
Okay.
we're gonna spin until it's hot.
All right.
Hey, so call her up, brother.
Oh, you want to do that now? Okay, cool.
Yeah.
All right.
I always give him the
Um,
time, but then I have to remind him every time to do it.
Is this the office number?
All right. So
Hi, Dr. Rita.
Hi, how are you?
I'm doing well.
You're Dan?
Dustin.
Dustin.
My
Nice to
cousin's
meet
name is Dan.
Oh.
So my grandma would sometimes call me Dan. So
you. So you work with Paul Wittenberger?
yes, I do. We were doing this show together. I've met you before. You visited us at Faithful Word. So what I'm going to do is I'm going to turn my face off of here. So you're going to be looking at a picture. Just if that's okay. Right, Paul?
Yep.
Okay. Oops, I always do that. I'm going to turn the camera off so nobody has to look at me in the corner so I can do what I want to do. So, Dr. Rita, thank you very much for joining us. I don't know why it's still there, but Paul, the camera says it's off, but it's not. So, we're just going to live with that. So, Dr. Rita, thanks for joining us. Everybody, we're joined tonight by Dr. Rita Ellithorope, and she is a doctor. Are you a doctor of integrative medicine? One of the first questions we have is, what is integrated medicine, and how would that be different from a general practice physician? Or
I suppose there are many terms used to describe doctors who have an open mind to looking at natural solutions, and the natural solutions very often and preventative measures help to keep their patients healthy and not progress on to the need for pharmaceuticals. So if you say integrative medicine, one definition would be we would take the best of necessary allopathic standard pharmaceutical, surgical, radiological imaging testing, and we merge it with the natural preventative measures. So we would say we are a doctor who can do both things. So we're licensed to prescribe medicines like a standard licensed medical doctor.
and currently you have you're working in an anti-aging facility right now. Is that correct? Or
I would say, yeah. I these are general terms.
Okay.
Anti-aging.
you teach
we
anti-aging, yes.
Yeah, we teach preventative medicine, and that keeps you healthier, and that keeps you younger and more capable. So to that degree, I'm guilty as charged of anti-aging medicine. Yeah, I did the A4M board certification for this when it first started many years ago in the 1990s. My father was in food research. When I was a little girl in Chicago, Armour Food Research was a meat packing, Armour hot dogs. What kinds of kids eat Armour hot dogs? Mm-hmm. I'm that kid. Mm-hmm. But my dad learned right away in the 1950s, when I was a little girl, the corruption of the food system. So I have been born into this since I knew about trans fatty acids when I was 7 years old.
So you tried to prevent the illnesses as a doctor. Are you focusing more on preventative medicine than treatment? Is that pretty much where you're trying to focus your energies? So
yes, absolutely. And for those who already have a disease, we have hope for recovery and to be able to heal and possibly reduce or eliminate their medications.
So one of the things our show has been very much focused on is the COVID-19 crisis that's been underway now for over 6 weeks, I suppose. It's since its first, I think it's been about 6 weeks, if not really close to that time. And so we've been talking about that. We've been talking to different people, different doctors, different scientists, and people who have different fields that they're working. And so you're, as a doctor, are you seeing a lot of COVID-19 related treatments happening in your immediate practice? Are you dealing with any of that, or what's your direct experience currently with that?
I'm seeing, just as I saw last flu season, people coming in with a flu-like illnesses, all right? And under flu-like illnesses in the CDC, we're not required on outpatient to do nasal swabs or PCR testing to identify anything about them. They have what is considered a common non-serious flu, and that's what I'm seeing. All my patients that have come to see me have been so healthy that I have had no reason to send them for hospital management or to even do any testing to confirm whether or not they might have COVID-19. And then even the question about the testing, to confirm COVID-19 is something that's argued amongst scientists.
Right. So currently, the way it seems to be happening is if somebody was admitted to the hospital for any type of treatment, right? Maybe and I don't want to say any type, all sorts of types of treatment, and it could be they could have some sort of well, let's just say they have general treatment, right? They're in there for appendicitis, right? Let's just say, and they would test them for coronavirus, isn't that right? That they're testing people across the board to see if they've got coronavirus in a way that they wouldn't normally do for other conditions?
In general, they're doing a wide swath of testing for all patients that come into the hospital with any type of fever or upper respiratory illness. If there was someone who presented to the emergency room with a broken leg, I don't think they're going to do that. Mm-hmm. And they do have to handle those kind of acute care episodes. But those who get tested for COVID-19 are being tested with what we call reverse transcriptase polymerase chain reactions, RT-PCR, which is looking for, in DNA, the double strands are nucleotides in pairs. And they're saying that the COVID-19 virus is new. So apparently in the standard coronavirus, there's a section of it that appears to be new and has some features in articles that I'm reading that have a genetic sequence that are similar to this original SARS coronavirus in 2002. And some parts of the nucleotide sequencing may have even some HIV, because HIV is also a type of rotavirus, coronavirus. And so the testing then of coronavirus by looking at a snip of just nucleotides based on a nasal swab and then put through an RT-PCR, looks for that and amplifies it over and over to see the sequencing or a part thereof. And then we'll say, yes, we think this is the new SARS COVID-19 sequencing. But there's a postulate out there in medicine. We were taught the Koch's postulate. Koch's postulate was a famous doctor who got the Nobel Prize, I think, around 1895. And Koch was a German who said, if you want to diagnose or give something an identification, you have to isolate the pathogen. And then you have to put that into another animal, and you have to see that animal manifest the exact same clinical features that drew you to test the first person. And then you have to take the pathogen out of that infected animal and introduce it to another and grow out this pathogen to see the actual item. So it's beyond a doubt that you have isolated the correct pathogen and you're calling it a true item. So Koch postulate has at least 4 elements. I'm not sure if I listed them all, but the idea being we are not following that program here. We are using PCR, and Mullis, who got the Nobel Prize for developing the polymerase chain reaction, he himself thought that this was really for diagnostic, not diagnosing a patient, but was a laboratory assay as the explosion of the Genome Project and studying genes and gene sequencing as opposed to ever being used for diagnosis. So I want to be clear, they are not viral culturing people out. There are tons of Petri plates out there with a patient's name on it, and they're culturing out a virus. This is not happening, to my understanding.
So they haven't. They're just finding certain markers that they could allude to being COVID-19, but they're not. They haven't isolated it as they should, using that postulate, Koch's postulate. So they're using another type of a broader type of diagnosis in this case, and it's not as certain. So that brings us to the question we have is, let me see how it's written here. How accurate do you think these numbers? So like it says here, to date, 56,000 people have died of coronavirus. I don't know if Paul wrote this. I don't know if that's worldwide. I'm not up to date on the numbers.
No, that's U.S.
That's okay. So how accurate? Because the United States actually, I think they've even said that they're more liberal in their diagnosis and labeling people having COVID-19. How accurate do you think this number is?
Well, let's put it this way. If you are worried about a serious, life-threatening beyond the regular seasonal flu, it would be better to be liberal in your inclusion and diagnosis rather than to miss people. For instance, when I went through my general surgery rotation, we were expected to have up to about 5% of all of our appendicitis cases to be healthy, normal appendixes removed. You understand what I'm saying? And if your rate of appendix removals doesn't include close to 5% healthy appendixes, then you're too critical in screening and leading to protecting people from their appendix rupturing, bursting, and killing them. Okay? So it isn't that I'm against PCR testing or the nasal swab. I'm just trying to be scientific and accurate about what our criteria are, okay? And our criteria are not based upon viral cultures, okay? You clear on that? So is the number 56,000, as I look at the John Hopkins map on my computer. Well, I would say there are 56,144 that the doctors believe, either met the clinical definition or have the nasal swab PCR test, and or they had some other serological testing. So yes, I would say that's true. Is that an overestimate? I would hope it would be an overestimate. To deal with a serious pandemic, you have to be more liberal to protect public health. But then the question you really should ask is, what is the doctor on the front line seeing? I'm one of the doctors who never closed. I've been here every day. I never missed a day of work, nor my other doctors here. And none of us in our general practice, and we see from children to the elderly to the very sick to the athlete, I would say close to 40% of my patients are Medicare, which would be in the higher risk. And I have had none of them, even those that have cancer, who have had any significant flu-like illness. And so I haven't tested anybody.
Okay, so what would be your procedure if you did? If somebody presented those types of symptoms, what would you do to check to see? Just if somebody was curious to know how you would handle that.
Well, it would depend on how ill they are. And I suppose if I really felt someone was succumbing to COVID-19, I would do a blood test and send it off to be tested. And then if they're still manageable to stay at home, I would have probably put them on high-dose vitamin D, vitamin D3. I would have given and made sure they're on a zinc supplementation. I would make sure that they're on a low-carbohydrate diet because sugars depress the immune system. I would make sure they drink plenty of water, and in much of the water they drank, I would put powdered vitamin C to drink liberally to get in, 4 to 10 grams a day, such that they would have a lot of vitamin C in them. And I would give them, we have certain nutraceuticals like elderberry and others that we know enhance the innate immune system of the body. Because really the approach that we need to look at here is building up their immunity, their ability to fight off a virus, rather than to send them home and just say, if you get to the point where you can't breathe, then go to the emergency room, the hospital. I'm here trying to build up their innate immune system. And maybe that's why all my patients have done so well, even my very ill and comorbid patients with COPD, emphysema, cancer, diabetes, heart disease, because my whole practice is based on not just treating a disease, but building up their health and their immune system. So I would say all my patients have lower blood sugars than the average American for their age. I would say most of my patients are already on a very good nutrient-based zinc multivitamin mineral. All of my patients are on a powerful antioxidant regimen. All of my patients are on a baseline vitamin D3. All of my patients are on iodine. So I think one of the reasons why I had no problems is all of my patients were immunologically well equipped, even in their comorbid states, to deal with this.
So how dangerous is COVID-19 then? Do you think it's possible that your patients or somebody who is immunologically sound, right, who's prepared, who's got the type of diet that you've just described, who's taking the right supplements and is not doing things that would compromise them any further, do you think they could encounter exposure to COVID-19 and have little to no effect?
Yeah. Yes, I think that's very reasonable. At least the question should be asked and explored. But for every one of the 49 or 50 White House news press conferences, except for the last ones in the past 2 to 3 weeks, the first time I ever heard of any nutrient being brought up really is zinc. So from day one, why wasn't the question how to build up the immune system if this is a virus? The question should also be asked, if indeed California, who gets a lot of traffic from the Asian countries, and I here have many Asian patients. And February 4th, I had one of my patients from Wuhan come to visit me. And she called to see, do I want to restrict her and so forth. And she came in and I examined her for other issues. We had lab to go over. So it's not like I haven't been exposed, or Californians here aren't in a high exposure rate. And we have Los Angeles and San Francisco and Oakland and San Diego. So we have pretty dense population. In fact, our state has about 40 million people. But why did we do so well as a state? And I'm going to say to you, they're not asking this question, maybe because they don't want to look at this question, and that is, Californians as a group of people tend to be more health conscious. We as a people tend to take the lead in health ideals, such as eating more fruits and vegetables, or taking vitamins, or exercising, and these kind of things. And I challenge the news, or anyone who has the time to do this, because I don't, they should go to Rite Aid and Walgreens and CVS and Ralph's and Albertsons and all these stores and say, how did the vitamin sales go through the last 3 months? Was your vitamin C sales up? Was your zinc up? Was your vitamin D sale up? Were your multivitamin mineral sales up? And the answer is going to be yes. So did California do exceptionally well because we immediately, being aware of this, upped our immune level of defense and protection? And I'm sure that that is the reason why we did so well.
Yeah, it has a very California, relatively speaking, say, compared to New York or Washington, D.C. or New Jersey. New York is many, like, if I can do it, it's like 40. California is like, I lost it in the shuffle here. It's like 40 or 50 people per million. These are deaths. And so, I mean, I'm not here flipping these numbers around, but compared to California, which is, or New York, which is like 1,100, it's like got 1,100 more people per million dying of this. So, are you thinking that's just because Californians generally take care of themselves, and their baseline health is better than New Yorkers?
Yes.
So,
and you can figure it out. Mm-hmm. Ask Walgreens, ask CVS, ask Rite Aid. Ask these businesses to do a report. It's a quick book, one-day test on what their sales are. And I can tell you my local stores have had all their vitamin C shelves gone, all the vitamin D gone. Mine have been gone. My suppliers, and I deal with the original suppliers. So I'm absolutely convinced that we need to talk about our innate immune system that originally encounters all types of pathogens every day of our life. And we're fearfully and wonderfully made, the Lord tells us, to deal with these things.
So I'd like to take that out of this whole thing. Whatever happens, I think it's important to be able to have a lifestyle. As Christians, if you're right with the Lord, you can walk with confidence in faith, because you don't have, like, your conscience isn't, like, you don't have a guilty conscience about something. So when you're right, it changes the way you interact. You have less fear. But as a Christian, you also have, if you feel like you're doing something wrong, you're afraid that God's going to bring something against you to set you right. And I think, in a way, if you're living healthy, if you're taking steps and measures to live right, then you can be more confident in not being afraid of having this virus get you, And so, so out of this time and what's going on, in this phase of our history, is, I think, as we leave it, we can all figure out what we need to do to be more healthy and do those things so we can make major changes in our lifestyles. But what they're doing short term now is they're putting everybody in masks, right? And that seems to be like they're not telling anybody on the news, hey, you just need to get healthy. You need to get some vitamin D3. You need to get some zinc in your diet. You need to drink more water. You're not getting that. It was wash your hands and keep your distance. That was pretty much the mantra. And it's not a proactive measure. It's kind of a retreating measure. But we don't want to be afraid to engage with people. We want to be able to walk and shake hands with people, and we want to get back to life as normal, and the best way to do that is to be healthy. But what is your opinion on these masks? Do you think they're helping? Do you think social distancing is helping?
I think anytime you're ill that you should cover your mouth when you're coughing, and if you're ill enough you should stay home. Is there anything new about that? That's what Grandma told you. So quarantining is and has always been for the ill and the sick. Healthy people are not quarantined. And if you have a good immune system, you're designed to be able to deal with this. That county report that came out last week from Santa Clara County in California is just north of where I'm at. And in that study, they showed that the prevalence of seropositive antibody-producing people was vastly higher, on order of magnitudes 50 to 81 times higher than the actual measured positives that they had, which means that anywhere from 2.5% to 4.5% of the population in Santa Clara County has already seen, exposed, and made antibodies to this COVID-19. That means there's thousands upon thousands in that county who were healthy enough to apparently get it, not perceive it that they had it, or it was so mild it didn't bother them to contact anyone for help in their healthcare system, and they did quite well. So no, I am not in favor of masks. That is only for the ill person or someone in a hospital setting who you have admitted and you do not know their diagnosis yet, and you suspect a highly contagious, serious disease. That's designed for a disease management in a hospital until you isolate what you're dealing with, not for the general public.
So the mask is, if I wear a mask and I'm exposed to somebody who's not wearing a mask, it doesn't make a difference for me. If somebody's not wearing a mask and they've got COVID-19 or they have some sort of contagious condition, if I'm wearing a mask, I'm still going to be exposed to it, in other words.
Absolutely. That these studies now are being done, that the prevalence in the population is already there. The exposure is there. We're not in containment at all, okay? And so they would say that we're trying to be in the flattening of the curve or mitigation phase. But we want people to be able to make antibodies to this and their immune system deal with it like it did last year. Were you worried last year? Were you worried in the flu season of 2018? I think there was a peak of 81,000 deaths for that flu in the flu season of the fall of 2017 to 2018. It was one of the highest deaths in the nation, 81,000. No, I suspected from the beginning that this was about the level of a flu and the seriousness of a flu, and I am seeing now evidence that there's quite a good amount of healthy people out there, and we are immunologically responding with antibodies. And I'm in that senior group above age 65, and I'm seeing all the patients. Your healthcare people in the hospitals are seeing them. Some of the hospitals are closed down. Some of the the emergency urgent cares, they're all being shut down because nobody's coming in to be seen. And there are other effects, of course, from isolation. one of the best things to help your immune system is socialization. And things we know about infant mortality is if an infant isn't touched and loved and socialized, that baby will die from a lack of socialization and contact. So, we need to be asking these scientific questions. When did we ever isolate the healthy? When did we ever quarantine the healthy?
So if you're just joining us, we're speaking with Dr. Rita Ellithorope, and she's a medical director of integrative medicine. She received her medical degree in 1982 from the Chicago Medical School in North Chicago, Illinois, and she completed her residency in family practice at Womack Army Medical Hospital. I throw Army Medical in there, but I guess Womack Army Hospital, and that's in Fort Bragg, and that was in 1983. We got a lot of information on her. I could go on. As she's a guest faculty member at Capital University. Is that correct?
That was teaching integrative medicine, Eastern medicine, alternative medicine techniques. That was in the Washington, D.C. area, and that school has now shut down.
So besides so Eastern medicine isn't considered allopathic medicine, then, is it?
No.
Yeah, that's antithesis, right? It's the
Right.
Okay. Well, that's interesting. There's a lot of things I'd love to talk to you about, and getting to know you a little bit more just by hearing what your opinion is on things. One of the things that people talk about is 5G, right? And there's these conspiracies that 5G is causing it. Now, I don't think it's good. My real estate agent, when I was looking for a house, he's like, hey, you don't want that house. It's right under the power lines, right? He's like, you don't want to be so close to the power lines. And I said, yeah, you know what? Yeah, let's skip the houses next to the power lines. And, you don't want your Wi-Fi next to your bed while you're sleeping. So there's definitely things where it can affect your health. Now, some people are speculating because correlation does not equate causation, and that there could be, in these densely populated areas, people exposed to more types of people with different immune systems, and different germs are exposing people. But it's also maybe where these 5G towers are going up. Have you heard any of the speculation or any of the talk that 5G could be compromising people's immune systems to make them more susceptible? I think that might be the argument that we've heard.
My research, the time that I have for studying, goes into looking for good scientific studies on the safety of these things, electromagnetic energy. And what I've seen so far just makes me have more questions about its safety. I'm not convinced that these electromagnetic waves are safe for the human. One of the things is the electromagnetic wave of 4G is at a certain frequency and hertz cycling that makes it kind of resonate with the electromagnetic frequency of the water molecule. And so when you turn your microwave on, you are turning on a designed energy frequency that compatibly irritates and syncs with the water in your food to make it jiggle, and that's how it heats it up. Okay? This new 5G level of frequency is much tinier than the larger frequencies of the 4G, and this seems to resonate with oxygen, the molecule of oxygen. So I'm concerned about that because these are human required physiologic elements that a human being, every cell has to have. So I don't think that the studies that I have seen are sufficient for me to endorse their use. And I have concern, yes.
It's one of those things that we really can't do anything about anyway. I mean, they're gonna set up. We have our cell phones, we have our Wi-Fi, and we do that. And by having the subscription to the cell phone or the plan, you kind of are giving consent, and they're doing it anyway because I think there's an agenda to make technology. I believe they want to be able to have a kind of what's the word I'm looking, like a cyber grid over the whole world, so they can be able to pass information from all around. And I believe that's something that they've been moving through for years. Now, regarding the government's response, you've already said that there's other ways that we could be handling this. What do you think about the government response? Some people think that this could be a power play on one. Like the whole thing was, as soon as they saw the opportunity, they took this as a chance to push forward some, one world agenda type of stuff. But then also it's at more local levels. Some churches have been shut down, some businesses have been shut down. So from the micro to the macro, the governments have been responding in ways that people are just thinking is overacting. What's your general opinion on that as a doctor?
My people perish for lack of knowledge, lack of wisdom. And I believe the more that we don't raise our children to fear the Lord God and to take on the personal responsibility for their behaviors and for their responsibilities to their fellow brother and sister, their neighbor. If we don't raise God-fearing families, then there is no hope. There is no hope. And whether it's sexual transmitted diseases that harm them, drug and substance abuse materials that harm them, fast driving that harms them, being addicted to video pornography and the blue light of the screen late at night, poor sleep cycles, the inactivity of their body. They're being programmed to eat and eat endlessly these valueless, processed, cheap foods that you can have home delivered, whose shelf life not even rats would eat, like boxes of cereal and stuff like that, and the perpetual surviving McDonald's burger and fries that is now, 20 years old under the cake cover. So what do I think is going on? I honestly think we have to teach the Word of God to our children. I am an evangelical, new independent fundamental Baptist, okay? I believe that when a person realizes that they are responsible not only to God but to their neighbor, then they'll start getting educated and they'll start trying to defend the defenseless, like the unborn, defend the child from vaccinations that are not well studied for their safety and efficacy. They'll start defending their God-given rights that He allowed us to defend under the Constitution as well. So, as doctors, we are facing a conglomerate machine. There is a science academia. There is a big pharma. And this science academia and big pharma and big business, medicine has become a machine, and the education process and selection process for doctors has become a machine, well advertised, managed system, which means it's very hard to find truth anymore. We think just because there's a big name like Harvard or Johns Hopkins or the NIH or the FDA or the CDC, we are programmed to think only truth comes out of these places, right? We are knee-jerk Pavlovian taught that only truth comes out of these places. And yet I know case after case. I'm prior military for 9 years on active duty as an ER doctor and a flight surgeon. I have personally encountered the corruption of the government healthcare system. And so do I trust anything on it just because it has a CDC on it or a FDA or a NIH on it? No, I do not. I'm published myself, so I have published on what it takes to help restore the energy and the health of the cell membrane. And I think that has benefited my patients. It certainly has benefited me, because if I'm able to publish in peer-reviewed scientific publications, I understand how to read scientific papers. And I won't be drawn away with fatigue of reading. You know, there's an old idiom out there: doctors aren't paid to read scientific papers. Only interns, or what do you call these, research graduate students are paid to do that, okay? But I must spend maybe 20%, 15% of every day screening and scouring the internet and the research on this, okay? Because I am a scientist. In the old days, the doctor had their microscope. The doctor in the old days, and when I was trained for getting gonorrhea, for instance, that's an anaerobic bacterium. It can't be around oxygen. So when I would do a swab for gonorrhea, I would immediately light a candle, get a mason jar, and then I would put my petri dish in that where all the oxygen was taken out. I mean, that's how old I am, you know? But I'm telling you, I was trained by doctors who had their own labs, you know? And I have mine, therefore. So I have my own lab. I do my own research. I publish. And Dr. Angel, who was the editor-in-chief of the New England Journal of Medicine, and I think she stopped that position in 2006. She, as she was leaving, and I'm going to paraphrase this, but her general statement was she was sad and remorseful to have to say that the majority of the papers submitted to the New England Journal of Medicine were of questionable scientific accuracy and efficacy, okay? More than half, you know? So, excuse me, I don't drop in awe just because it says the New England Journal of Medicine or the NIH or the CDC. The tire meets the road here in my office between my patient and me. And there's a very special bonding here. My patients look to me for authenticity, for integrity of work and competency. Otherwise, they wouldn't come. They won't come back. And I will stay here no matter what. I've been at this one location 20 years. A little over 20 years, and I'll stay here until the Lord allows me, you know, to go to heaven, because I have no intention to quit doing research or quit working. But today's methodology is, I'm gonna buy a house here. My husband's going there. I'm gonna stop working here. And by the way, I asked my husband permission to become a doctor before I went to medical school. Okay, I was a Christian, and so I was not at all a part of the women's equal rights liberation movement of the 1960s and 1970s. And I asked him permission. And then, you know, he was, that was in the Vietnam era, and he was on active duty. So while he was gone, I just took my Bible in one hand and my chemistry, biochemistry, physics in my other hand, and I just stayed in the university and studied and studied and studied. I enjoyed it because I was in my father's labs at Armor Food Research, so maybe God had something, you know, planned for me to like this kind of work. But I am not a women's liber.
Oh,
I am a grateful person to be able to serve my Lord and share the gospel with each and every patient that allows me to give him all the glory.
That's wonderful. We're talking with Dr. Rita Ellithorope, and she is she's been practicing medicine for how many years now, Doctor?
About 40.
40 years, and she's just been sharing with us just general health suggestions and how she's responding to the coronavirus outbreak and what she recommends. We're also, during this episode of Framing the World Live, we're going to be doing a drawing or several drawings for whoever would be interested in winning some free prizes. We have a whole list of things that we'll go over shortly after. But the way you get involved in this and become a potential winner is by buying anything at the Framing the World store during this broadcast of Framing the World Live. So you can go to framingtheworld.com and purchase anything there, from a citrus peeler to a t-shirt to a movie to a toothbrush or some DMSO. We've got the Deported DVD there. We got some CDs. You can purchase anything, and your name would be included in one of the few drawings. How many drawings, Paul, are we going to do? Like 8 or so?
Yeah, we're giving away some T-shirts. Here, you know what? Let me just go through it. So we're giving away the Fluoride Poison on Tap T-shirt at the end of this stream. We're giving away the Don't Tread on Us CD, Fluoride Poison on Tap movie. We're giving away a POH toothbrush, which is awesome. We're also giving away some DMSO and a citrus peeler. So we're giving all that away at the end of the stream. Make sure you stay till the end, and also support us on Patreon, guys. All you have to do is donate $1 a month on our Patreon account, and you'll be entered in for a chance to win that.
Terrific. And so, Dr. Rita, you kind of tied some thoughts together there. I don't know if you intended to, but it leads into my next question. But like, the problem is that people are not dealing with each other in a spiritual type of way. We're not taking care of our neighbors. We're not doing the things that please the Lord. And so therefore, doctors, when they're sitting down with their patients, they're not seeing them as their neighbor. They're just seeing them as maybe something else, as a customer who's paying and they're getting a service, or, I don't know how to look into the mind of doctors. But do you believe that a lot of today's medicine, and you mentioned the journals and what's being published, and that there's a lot of credence given to what's been published in certain journals or what comes out of certain hospitals or medical schools? Do you think a lot of today's medicine is being pushed by the pharmaceutical company?
I don't only think it, I know it. And the pharmaceutical companies have marketing engineers and very, very well-paid, forward-thinking marketers. And you can only develop so many blood pressure medicines, so many antibiotics, so many reversions of pain relievers and stuff. And they want the market to go worldwide. And these uses have limitations. The patent runs out on them. And so the income of the pharmaceutical industry is teetering somewhat, in my opinion. And so what would be a wise financial maneuver for the stockholders of pharmaceutical companies would be find an area that you could have a recurring consumption of a pharmaceutical worldwide. And vaccinations fit that definition. Demanding and working through lobbyists and other organizations that you would finance, donate generously to help support the promotion of vaccination as the one-shoe-fits-all solution to making the world. They've even linked it to the climate change, making the world a safer and healthier place through all these many, many programs. So it isn't that this is illegal. It's just what is happening to the world through greed and lack of moral constraint. I mean, I know professionals who would argue that there's been corruption in vaccine research and there have been cover-ups. So what am I supposed to do as a physician and a scientist myself, knowing people like this, and I believe them, I have my doubts and my concerns that vaccines are the solution, the one shoe fits all, but I'm telling you that's where it's headed, through the World Health Organization, through the CDC. This is going to be the thing that they're going to push, is vaccinations for everything. And they have to market to you to make you yield and ask for it, okay? So I think we physicians are undereducated in science. These doctors get into a small box of medicine. Maybe they're a ear, nose, and throat doctor, or maybe they're just a neurologist, or maybe they're just a cardiologist, or maybe they're an orthopedic, or maybe they're a dermatologist, or they're a gastroenterologist, or they're a gynecologist. I mean, they have all these compartments. And yes, I need my specialist. When I have a problematic patient, I need to get on the phone. I need to present the case. Just like in medical school and residency, I need to share and get help from a specialist. But I don't need 1,000 specialists. I need 1,000 good doctors keeping everyone healthy, okay, preventatively, so the need for the healthcare dollar goes down and the well-being of the people goes up by building your innate immune system. That's what I am for. But guess what? There's no money in that. Guess what? There's no investors in that. Okay? So we do right things and correct things, not because we make money at it necessarily, okay? But pharmaceuticals and stockholders demand that there be projections and fields of marketing that the industry will move into. And voila, we have arrived at now world pharmaceutical vaccination propositions. And how convenient to have this potential pandemic to frighten everyone, even though we're learning that the mortality rate was vastly overestimated and in fact is at the level of the yearly annual flu. But that's where we're headed, folks. And if we don't raise moral people who are not just driven by a profit margin, then this must happen to society. This is the devolving, following the greed and following the academic lookaways, even the research in the HIV for AIDS, right? That research, the Dr. Gallo, who was alleged to have found originally back, this is when I was in getting out of medical school, he was purported in the United States at the CDC to be, we found the agent that causes AIDS, the virus. And Dr. Gallo out of the CDC was getting news briefings on this. But in fact, it was a Dr. Montagnier in France, okay? And it turns out many years later that, at least back then, there was an ethics board that punished Dr. Gallo and criticized him for incorrect ethics, let's say, in the hallowed halls of the CDC and research. And so, folks, if as recently as AIDS, there was greed and pride, and I want to be the person who gets the Nobel Prize, it's in us all. There's none righteous, no, not one. And you have to keep an eye on your industry and the people who are in medicine, in making your car, in making your food. There has to be ethics there.
Well, maybe I don't have much hope that that's the direction we're moving, unfortunately. I believe that the people who are ethical have to be, or those who are of faith have to be more salt and more light. Like we as individually, like we have to stand that much stronger than anybody ever has. It maybe in this time, and that the world is just going to get darker in that, and it just compels us to take that much of more of a stand and to speak the truth that much more. Now I've got a couple random questions. I've taken some notes and we've gotten some questions from the chat. But do you know? Can you just explain? And back to the coronavirus. Can you talk about the different types of coronaviruses?
Family. Now, I am not a virologist. I am a generalist. But I'm well versed in discussing this in that that's a family of viruses. Just like you have phylum and family and genomes and species and stuff, the same as in the world of viruses. And there is even a higher hierarchy over the corona one. But even this one called COVID-19 has already had quote unquote mutations in the nucleotide pairing in the assays that have been done by PCR testing, so that we can even regionally look at this. Looks like the mutation COVID took in India, which is different from the mutation it took in the United States, which is different from the one it's in Europe. Do you get the point?
Do you think they're natural mutations, or do you think these are manipulations that are done in laboratories?
Well, if you ask Dr. Montagnier, who got the Nobel Prize in 2008, I think it was, for discovery of the AIDS virus, okay, the virus that causes AIDS, his own statement is that this is a manipulated virus. This is a chimera or a generated thing. So I am not a virologist. I don't splice and piece things together. I don't go chase bats and look at because they're a very natural reservoir of coronaviruses, but many animals have it. So all I can do is take men like that who have great integrity in their field, and if he's publicly saying he thinks this is a generated, manipulated virus, I have to then be left with a question, and so forth. But what I do know, and what I can be strong on, is that it has changed as all these viruses and bacteria that develop resistance to antibiotics and stuff. There is a degree within the species of reacting to their environment too, right? Mm-hmm. So I'm very curious. So he's not feeling that this is something that is jumping from an animal to a human, but that it was designed that way. I'll never know, but one thing I do know is that we can build up a great immune system to fend that off, and that's where I'm going to pour my heart and my soul, because it's what I can do.
Right.
I can read about vitamin D research. I can study vitamin A. And why don't I get money to do that kind of research? They won't fund it. And that's another way that they direct the whole field of science, by keeping doctors like myself having to self-fund. I mean, I've gone to wealthier people and patients, and I said, I'm trying to do research on, cell membrane and fatigue, for chronic fatigue, natural hormone therapies, anti-aging. But nobody wants to give me the money for it, okay? Because who's going to make a lot of money on learning how to eat better or take a special nutrient? But if you have a group of philanthropists, very wealthy people, and you get them in a club, and you say, I'm going to have a picture of you cutting the ribbon to the new Wuhan Center that we helped build in Wuhan, China, because you helped donate to it, let's say. I don't know if that happened. Mm-hmm. I'm just, confabulating that. But they get them in these pictures, and they get their names on plaques. And what happens is there's this good old boy, thing. It isn't necessarily illegal. It's just whatever makes the money, follow the money is what you have to do. So these philanthropist organizations and these marketing organizations, and don't you think that they would want to be, let's say, promoting commercials for their medicines on TV? Well, that never happened before, right? And so when commercials eventually said they marketed and they lobbied for it and they got it, well, maybe there might be some congressmen and so that maybe are getting on the boards of maybe some of these things. Maybe some of the people who are on the boards of the CDC, once they supported a vaccine research program, when their tenure was done, they get put on a board and have a multi-million-dollar position, which is peanuts to a multi-billion and trillion-dollar pharmaceutical future. So you see, nothing necessarily is illegal. You see? Mm-hmm. And I know, in fact, that the head of the research on the MMR vaccine, the whistleblower, William Thompson, was the head of that research study at the CDC. William Thompson did this. And it came out in 2004 in the Journal of Pediatrics, that this was told to be not associated with autism. And then years later, Dr. William Thompson, the virologist, couldn't bear it any longer. His conscience came to him, and he admitted to the data that was thrown away, numbers that were refiddled, and it was indeed associated with autism. And I know that the head of the CDC that year, then, because Merck was working with the MMR vaccine, I know that she got a position on Merck's boards.
So, if you were the Surgeon General, and you're not in the club, so I doubt you're going to get the job. So
yeah, that's right. You see, we thought, and you probably think that science is about a lot of individual men and women doing science and thinking and challenging the hypothesis and testing it.
I know that's the definition of science.
That's not it at all in today's science.
Right.
It's industry-designed research for the outcome that you want. And I was actually in North Carolina, in Raleigh, and I would actually see research advertisements that said, "We'll get the results you want." And I'm a researcher, besides being a doctor. That's unconscionable to have advertisement that says, "We'll get the research you want, the results you want," rather. That's like whores having their advertisement at the airport saying, "If you're not busy tonight, call this number," when you get off the airplane. That's unconscionable, right? To see whore advertisement on billboards coming off the airplane. Well, how is that different from that in Raleigh when I was going through there to the Army medical centers and Raleigh Research to say, "We'll get the results you want"? No, you have to understand, when there's so much money, you get the TV advertisement because you lobbied for it. And just you argued your arguments so beautifully because you had enough money to have enough lawyers to argue it for you. And they wouldn't stop. Even the Bible talks about the judge that finally listened to the woman who kept on petitioning him, and he said, "I don't have to do this, but because she keeps on bothering me." So there's an actual legalese of just constantly pushing and lobbying for something because it's not technically illegal, okay? But the ethics of selling, advertising medications on TV is immoral. It'd be like, it's immoral, because it's generating a bunch of people to go to their doctor and say, "I saw on TV this, can I have it?" That's not right.
They get a lot of samples, the doctors do, and I know I've heard of pharmaceutical reps that there's benefits that go to doctors if they're going to help them be part of their spreading of a new sampling, right, of those types of things. But we're talking with Dr. Rita Ellithorope, and she's, we've been talking about the current situation with the COVID-19 crisis, but just general health and what we can do about improving our own immune system to make sure that if we encounter this virus that we can just blow through it and not have any issues. And also we've talked about some of the things that are happening kind of ethically with what's being pushed along the narrative and how people are responding. If you're watching this show from the beginning, you would know that we're having a giveaway at the end. But if you have just joined us, we are going to be giving away 6 different items: a t-shirt, a DVD, a citrus peeler, some DMSO, a couple other things. And the way you get entered into that drawing is by becoming a new Patreon at Framing the World at Patreon there, patreon.com/framingtheworld. Become a new Patreon and pledge as little as $1 a month, or upping your pledge. You can be entered into the drawing. If you want to do that and also buy more than one thing at the store, you can have multiple entries into the drawing to win at the end of the show. So if you were the Surgeon General, Dr. Rita, what would you do right now? Would you just end the lockdown? Would you just start pushing out, would you just be dropping off the vitamins and the treatment? Like, what if you could just get on the news as a doctor and they got rid of this Fauci guy and they said, you know what, we're serious about fixing this problem. We're not pushing for this vaccine agenda, which we all know they're doing. They're taking this and they're pushing their vaccine agendas. And whether politicians are involved at any degree, we all, or the media is involved. Who knows what's happening exactly? But we know that these things happen, and as you've mentioned, there are people who are doing it for the love of money, and there are people who are just deceived because they weren't raised to fear the Lord, and even our neighbors, the people that we encounter every day, are they don't fear the Lord, and this could be something that God has brought about just as a result of that. You mentioned all of the bad things that happen as a result of not living righteously. Somebody has a question about herd immunity, but besides that, what would you do as the Surgeon General? What would you roll out tomorrow to deal with this issue?
I would roll out knowledge, because Proverbs extol knowledge, and with knowledge, wisdom. And I would teach these people on a weekly broadcast about the value of vitamin D, a low carbohydrate diet. What's so funny is Bill Gates is some of the biggest investments he has is in corrupting companies like Pepsi-Cola, Coca-Cola, fast food restaurants, and the like. Don't tell me that he is really worried about global health. Excuse me. That is a very cool marketing plan. It's like, your actors, they have this image on TV but for a persona, but their real life story is a horrid mess. No, Bill Gates is supporting things that tear down the immune system. So every way and any way you can uphold the Word of God and say, if God says we get a good life from knowledge and wisdom, and that from the Word of God, then I'm going to be right up front and say that we need time to humble our hearts and become teachable, okay? Maybe the men today have become frightened because even though they might be handsome and tall and strong and young, yet they're afraid of a little virus coming at them. Let me tell them, just like Elijah told his servant when all the Syrians were surrounding him, he said, Lord, open their eyes. And he could see all the chariots and stuff. They that are with us are more than that, are there. So I would begin as Surgeon General with education, knowledge. I would teach them how magnificent their innate immune system is, how magnificent water is as their number one nutrient, to drink water. I would teach them how magnificent a good night's sleep is for their immune system. I would teach them how excellent it is to eat a low carbohydrate diet. And I'm telling you, I'm here every day. I've never taken a vacation in 40 years. And those who love their work have never worked a day in their life. I love what I do, and I love my patients. So they come in here all the time, and I'm teaching them, about getting a good night's sleep. Did you drink enough water? Are you exercising? Are you moving your bowels? Are you eating a low-carb diet? And everyone's sitting there, I eat a great diet. I eat a healthy diet. Then I do their lab, and on their lab, they have a fasting blood sugar of 96, and their doctor said it was fine before. And they have a fasting hemoglobin A1C of 5.7, and their doctor said it was fine. And no one did a fasting insulin on them, And they come to me, and I tell them, you are not fine. You are pre-diabetic at 22, sir, ma'am. And you're on your way to the diseases that high starch, carbohydrate, sugary, latte, fate, frappe, whatever those drinks are, your sugar drinks, even spinning up these smoothie drinks are so full of bananas and fruits and apples and stuff that it becomes a sugar fix that replaces their Coca-Cola drinks. We are deceiving ourselves. And it is no wonder that the life expectancy is now starting to come down because of your generation. And so I have to look like the big old bad mama doctor here, you know. But I love my patients, and I teach them, and I tell them, you're not cutting it here with me. I will not tolerate a fasting blood sugar above 85. I won't tolerate a fasting hemoglobin A1C above 5.2. I won't tolerate a fasting insulin above 3. But the ranges on my lab paper say I can be higher. And I said, and that lab is a conglomeration of committee agreements and population samples. It has nothing to do with the truth. And we have a tidal wave of obesity, cardiovascular disease, diabetes, and many other chronic metabolic diseases. That lifestyle will change alone. And I'm not going to make money writing you a prescription on it.
Mm-hmm.
That's why I need a relationship with my patients so they know I'm the real deal, that I really care. And maybe that's why all of my patients, I'm so proud of them. I haven't had any, even of my severely ill, to become, succumb, to this COVID-19.
Well, Dr. Rita Ellithorope, she is a staff physician and the director of women's studies at Whitaker Wellness Medical Clinic in Newport Beach, California. So how far are you from Los Angeles? Or is that?
Yeah, that's old.
That's old. Where are you?
Yeah.
Where can we find you?
Tustin, California. There's the ocean, and then Newport Beach, and then the next town in is Tustin. So I've always been where there was less money. And Oofaloosa.
So you've just got to practice there. What's the name of the practice?
Tustin Longevity Center. And my website is
I see it. Yep.
Yeah, tlcdoctors.com.
It's like Dustin, but with a T.
Yes. Yeah. There you go, like your name. There you go.
Exactly. I can't forget that now. So we've got a question about, so your website is TLC, what was it?
Doctors, DOCTORS.com.
TLC Doctors, tenderlovingcaredoctors.com.
Yes, that's Tustin Longevity Center, Tender Loving Care, Together Loving Christ.
Right. That's awesome. So we have a question about the herd immunity that is said to be happening in Sweden. Have you heard of that?
Oh, yes.
And so apparently they haven't done any kind of lockdown there, and that they're just moving along with business as usual. Do you believe that narrative, that they're actually exposed to it just as much, and maybe they're just a healthier type of society, and they don't have the same type of vulnerabilities that maybe you'd find in New York or these other, like Italy or something, and so that they are able to get a herd immunity, as they call it?
Well, if you look at Sweden and then compare it with some more comparable place, their neighbor like Norway, okay? So they have a similar kind of lifestyle, socioeconomic lifestyle. And Norway did the typical shelter in place, these more draconian restrictions. And Sweden did a much more liberal. Now, they did let the children, the kindergarten all the way through, I think, junior high, go to school. But their seniors, they kept isolated. So they were much more liberal in keeping shops open and cafes and things like this. And if you look at their death rate per capita compared to Norway, that did the absolute shelter in place, they're almost identical. Now, their populations are different. I think Sweden has 10 million and Norway has more like 5 million people. But if you look at their incidence of death, you're going to see that they're basically similar, their rates of death. So I am convinced that letting healthy people work and take care of the economy and provide the things needed for living is the right way to go every time. And you cannot restrict the healthy people and their liberties. You must restrict and quarantine only the ill. And that's just where I'm going to stay until I see otherwise. And this downturn or flattening of the curve and the good results in California, to me, are just as much due to all the sales of vitamin D, vitamin C, the zinc, the multivitamins, as it is any face mask and social distancing.
Oh, yeah.
Okay.
My microphone button guy is sleeping on the job, maybe. So I've got a question about germ theory versus terrain theory, right? Because I've heard people talk about this. Can you just give us a quick, if there is such a thing, a quick, because that goes all the way back to Louis Pasteur, doesn't it?
Right.
How would somebody understand that?
Well, Pasteur is like one of the scientists today, and maybe he was more sincere because I think it was more novel and less politicized and financed back then. But he found the bacterium that he thought, caused a certain disease. And this finding of the bacteria made him famous. And on his dying bed, it said that he agreed with his competitor colleague, and I forget his name, Pasteur or whoever it was, and he said he was right. The terrain is everything. The pathogen or the bacteria is nothing. Meaning, his friend, colleague in science research was saying your immune system, your water, your sleep, your healthy diet, your low-carb diet, all these things, the hygiene. In fact, you could argue that we should actually applaud our plumbers and our, our sanitation experts, for all of our health, because it's sanitation that correlates with the demise of all these community-acquired diseases. If you go back to even 1900 and you look at, scarlet fever or rheumatic heart disease from the strep bacteria, if you go to mumps, measles, chicken pox, you go back to pertussis, you look at these and you find that long before there was ever a single vaccine of any import at all, because I know there was that smallpox scratch test from the cow pox back in the late 1700 to early 1800, but the vast majority of science shows that as civilization and nutrition and sanitation improved, all these diseases went away even before the Salks polio vaccine.
Mm-hmm. So I also have a question, just a personal question. It's anybody can probably benefit from this question, but I have a daughter who's now 3.5, and back in November we had to take her to the emergency room because she had a fever and it wouldn't go away, and they thought she had strep, so they gave her antibiotics, and we felt like after 3 days of a fever with the 3-year-old, so we took the antibiotics, and then it didn't go away, and we ended up going to a different hospital who said she had appendicitis and that she'd ruptured her appendix, and she had to have her appendix removed. Now, I know some people say, and even the doctors say, they don't know what the appendix does. But throughout that event, my 3-year-old daughter, who just turned 3, she was on a lot of antibiotics during that time. And so she had her appendix removed at 3 years old, and she was on antibiotics. And then maybe 4 months later, she had another fever, and her throat was really swollen, and the doctor looked at her throat, and she had really white tonsils, and so they said that they felt she had strep. So again, she's on another round of antibiotics, not even 3.5 years old. So having gone through that, one of our concerns is we hope that we can get her back to having the same type of biome in her gut and those types of healthy things for her. Now, how far back was she set in that? She did almost 10 days twice, if not more, twice of antibiotics, because the second batch of antibiotics weren't effective. We had to switch and go to a different antibiotic. So what would somebody do? What can we do? We've got probiotics, the yogurts, the kombucha, the sauerkraut, all of those types of things in daily doses of those, raw milk, and that's what we're doing. But how can somebody who feels like maybe they're behind the curve, forget flattening the curve, you're behind the curve on these things. What can somebody do? What can we do? What can our listeners do if they feel like their immune system has been compromised because of maybe that type of experience? What would you suggest?
Well, you did some very excellent things, but my patients in general think they are on a low carbohydrate diet when in fact they're on a lower than terribly high carbohydrate diet, because we're around starch, carbs, carbs in our drinks, carbs in our gum, carbs everywhere, carbs at the gas station. So we're in a sea of sugar, which is immunosuppressive. So I would be extremely careful about the diet of our children. They don't need all these snacks that are packaged. Give them the apple, give them some carrots, things like that, and strawberries. Don't be giving them all these goldfish and little animal cookies and foolishness and apple juice and orange juice that are full of sugars. Let them eat a sliver of apple, not take the juice, because that is a tremendous immune suppressor. And that also will promote yeast and candida. And though that produces neurotoxins and toxins itself, is immunosuppressive. One of the things we do here at Tussle Longevity Center is we do forward-thinking tests like a complete digestive stool analysis that actually looks at the plethora of bacteria in the stool, looks at the digestion components of the stool, looks at inflammatory markers of the stool, looks at, parasites and ova that are in the stool. And so it's a complete digestive stool analysis, so you can actually measure this. Now, whether or not the insurance will pay for it, how interesting it is that many and oftentimes the insurance company pays nothing for preventative restorative medicine. Okay? But anyway, so we have these capabilities. We have blood tests that do micronutrient assays, so I can look at the vitamin A, the CoQ10, the lipoic acid, the vitamin C level, the vitamin K2 level, and all these very wonderful micronutrients. So there are tests that you can do at clinics like mine, and I'm sure there's probably wonderful ones there near you in the Phoenix, Arizona area. There is an organization that I help teach at. It's called the ACAM, the American College for the Advancement of Medicine. So I've been a member and a teacher there for chelation therapy for many, many years. At acam.org, acam.org, usually has forward-thinking doctors that are opening their eyes to complementary ways to help their patients, and one of them is chelation, but there's many other things that are taught there. If you put in acam.org and say find a physician, you'll probably find a more sympathetic, a more informed doctor than a standard allopathic pediatrician, family practitioner, internal medicine doctor, because you don't get this training in medical school. And my poor colleagues in medical school, I don't fault them. They had no idea what they didn't know, okay? They had their preventive medicine class was probably a half day on vaccine schedules, thinking they're doing preventive medicine, getting taught about vaccinations. So you got to forgive them, but at some point, these physicians have to start perceiving that their children are getting sick and their aunts and uncles are getting diabetes and obese and chronic degenerative diseases sooner, and they've got to open their eyes. So at some point they become culpable as to why aren't they looking elsewhere. Not in replacement. I will use an antibiotic if it's necessary. I will refer for, cardiology consult, for unstable angina and get the angiogram and hospitalization, I'll do the standard medicine. But hopefully I can prevent that with the way we manage patients here. But if I need to, I will use my consults. But back to your daughter. So yes, probiotics. Now the thing about milk, I'm not a dairy supporter. Certainly not of the standard dairy that's pasteurized and homogenized and turned into an inflaming, broken up piece of white fire water and white fire bricks called cheese. Raw dairy, I'm more tolerant of. But you see, in our country, I tell my patients, we've rotated. God has the day and the night. He has a day to be born, a day to die. That He has the whales migrate. It's fun to see the whales out here in migration time. Birds migrate. The fish migrate. Planting is seasonal. Not everything plants at the same time. God is a God of this magnificent variety. And so I try and teach my patients that you are being subliminally trained to eat the same food over and over and over and over and over and over again, okay? So you're being trained that you should eat breakfast and it should be a cereal, and you're being trained to stop at the Subway or McDonald's or Del Taco or even Chipotle. You get these patterns, right? And that's not what the gut needs. So we teach a more simplified one menu day, and we teach a rotating diet. And what I mean by a rotating a one menu day, we teach that whatever you make for dinner, make enough of it so it's your brunch the next day. And we teach eating only 2 times a day. Because your gut is an organ that has 80% of your immune system here. And if you're constantly feeding it, your immune system is watching your food all the time rather than allowing the immune system to do a more proper surveillance. So if you eat a more simplified, less wild and spicy, crazy entertainment diet, and you eat a more, like our forefathers, I don't think our Lord and Savior Jesus Christ, had, fish for breakfast and with eggs, and lamb for lunch, and what would be another thing?
Unleavened bread.
Yeah. Yes, he wouldn't have all this variety. They wouldn't have that much variety. They would have their meat day because that's what was on sale, or their fish, and they would eat that. There was no refrigeration, and so they had to eat it all up. So whatever was left over from dinner last night, remember in the Bible it talks about the second day you may eat it, but on the third day it's a contamination. Well, that's based on food rotting, And what's interesting about food rotting is my father in Armor Food Research, he was hydrogenating the fats of the foods so that it would extend the shelf life for the manufacturers to do more shipping of food long distance. And he would have to manipulate the spices in the food and hype up the sugar and the or salt taste so that you wouldn't sense the deterioration of it. And when they hydrogenated it, it stopped the essential human fatty acids from combining with oxygen, because that's what's called rancidity, where the food is rotting, okay? So we're eating a bunch of cardboard, essentially, which is valueless. And that's why we're all zinc deficient. And maybe with all these chemtrails and the minerals in the sky, they have aluminum oxides and barium oxides that they're spraying in the sky that redirect the light from the sun, the wavelengths, in this argument for alleged global warming. It used to be global cooling when I was a young person, but now the flavor is global warming. But either way, those aluminum particles and those barium particles are landing on your organic fields and so forth. So we're becoming toxic with toxic metals because those are toxins. And where was I going? What I'm trying to point out is the food system is corrupted. Fats have been hydrogenated to extend food life. So even if you go to these fast food restaurants, they will use things that have long shelf life, and they'll put spices and flavors in them to get more use out of them. So we've got to teach our people to cook at home, cook more humbly, eat more simplistically, and not eat as many carbs, and you'll have a better immune system, less diabetes, less obesity, and heart disease, and even cancers.
I hope our listeners are listening to that, because that's good advice for everybody. Somebody has a question about spicy, because they heard you say spicy is bad. So having hot sauce on your food isn't a good thing?
If you have to do that every day, I'm saying that that's probably a problem for your immune system, and you're probably going to build up an immunological antibody to it. So I'm not saying spice itself is wrong. I'm just saying if you think you can eat whatever you want every day of your life because I want it, well, you're wrong, because your immune system is a little bit delicate. And if you eat that same food and that same spice day after day after day after day after day after day, I'm telling you, you're going to develop an immunoglobulin to that spice or that food. And how do I know this? Because I've been doing this for decades, and people's jaw drop on the floor that they're making IgG antibodies to avocados, or they have IgG antibodies to eggs, or to spinach, or to coffee, or, something you're doing over and over and over and over to excess. So, no, spice is fine, but where's the balance and the humility? Why don't we eat food so that our day is about our work and the people we serve, not about what we eat, and it's always a reward, Why don't we let food be food, and then on your birthday you can have a treat, and on your anniversary you have a treat, and on Thanksgiving you have a treat, and on 4th of July you have a treat, and on Easter you have a treat, and on Labor Day you have a treat. Do you see? We have been programmed that this little body of ours deserves its entertainment, food, sugars, and food spices, and we're killing ourselves. And we're inflaming our gut. Just because you can't see the rash that is along your gut doesn't mean it isn't there.
Wow. Well, I think we've probably gone over our time that we had scheduled you for. I think we've done a really good job of just really getting into it. So we thank you very much for coming on the show with us, Dr. Rita. I really enjoy talking with you. Somebody did ask if you took any patients by telecommunications.
Yes, we do. We do have teleconference. We do hope that you make it here so that I can physically see you. But yes, we do. And I'd be happy to come back again and answer questions and just respond. Excuse me. So, thank you, and my son wants me to come home for dinner.
Okay, good. I hope he's not making anything too spicy now.
Yeah, there you go.
Yeah, so since you did us the great pleasure of speaking with us, we would love to continue this conversation at another time. As you'd mentioned, if you were the Surgeon General, you would want to do something for the people. Yeah. And I think we could be a great place for you to do that, and I think our people need it, and once it gets on the internet, we can pass it around and share it. Excuse me.
Sure.
But before you go, would you do everybody the service of knowing, how they can find out more about you, and if there's anything you're promoting? I know that you had done a documentary in the past with Pastor Mejia. Are you guys planning on doing something again?
I think so. If you go on the YouTube and you put in the name of our medical clinic, it's called Tustin Longevity Center, YouTube. And when you put that in, my channel will come up, and then click on my logo. There are the caduceus there. Click on that, and then my personal channel will pop up, and then hit videos. And you'll see all kinds of topics there, from pregnancy health, nursing mothers, irritable bowel, leaky gut, cancer, heart disease. You'll see all kinds of videos.
And has you lately talking about the COVID-19 updates? Is that the right channel?
Yes.
Okay.
Yeah, there's quite a few. But if you scroll down, you should see many more.
Patient testimonials. Okay. Well, I'm going to go ahead and share that with our people in the chat. So, so that is Tustin. It's like Dustin with a T, Longevity Center there at YouTube. And your website is tlcdoctors.com. And we're speaking with Dr. Rita Ellithorope. I've been saying that right? Ellithorope?
Uh-huh.
All right. And so we're so grateful that you join us, and we don't want to take you away from your dinner plans with your son. So is there anything you'd like to say in parting?
I want to bring up a scripture. If you go to Isaiah chapter 3, verse 11 and 12, it reads, "Woe unto the wicked, it shall be ill, for the reward of his hands shall be given him. As for my people, children are their oppressors, and women rule over them." So I just want to point out that we're in a time and season where we seem to have young people, with not experience, and women not in their place, not in their place. God help us all. And I just want everyone to clearly know I'm a doctor practicing by permission of my husband. Okay?
That's great.
All right.
Wonderful.
All right. Thank you.
God bless you. We'll talk to you next time.
Thank you so much.
All right. Thank you.
All right. Have a good day.
All right. Bye-bye.
All right. So that was great.
Yeah, I had a good time. That was good.
Yeah, I think that would be a great idea to have her back once a week to talk about just different health topics and how we can do, because I was kind of taking mental notes of like, yeah, I do that, I probably shouldn't do that, and just kind of like, man, how could I clean up my life?
Well,
my
the
kids'
spicy
life?
thing had me at
You're like, whoa,
that's a little
easy.
too intense. Yeah.
Paul was just thinking, hey, I don't put sugar in my coffee. I'm fine.
Right.
I don't use sugar.
Yeah, that's the only thing.
It's okay. It's 10 cups a day. There's no sugar. It's fine.
He's like thinking, don't say coffee. Don't say coffee. Don't say coffee. So,
well, guys, make sure that you support us on Patreon. All you have to do is just up your support $1 or order anything off of Framing the World, and we're going to be giving away a ton of different things at the end of this stream. We're going to be giving away a Fluoride Poison on Tap t-shirt. We're going to be giving away some DMSO. We're also going to be giving away the Fluoride Poison on Tap DVD. And so if you haven't seen this film, make sure you check out this film. It's definitely one of my favorites, if not my favorite film that I've made. So I really hope you check that out. I put a lot of time and effort into that film. It took 3 years to complete, and I definitely do love it.
all right, so I want to pledge $1, and Logan can pledge $1, because are we getting enough people into this thing?
Yeah, we're getting people.
Okay, because if we're not getting enough, we're just going to have to include
You want me to
ourselves.
tell how many people we have?
Yeah, well, read them off.
Yeah.
We have 4 right now, so we don't have enough.
Yeah.
Paul's giving away the whole shop today. We decided to give away everything in the
we're just
store.
gonna have to-
Also, I forgot, and you get entered in for a chance to win Orion sunglasses too. At the end of the week, we're going to be giving those away. So, yeah.
Logan was like, you're giving away too much stuff, and everybody's like, yeah.
Well, I was not going to give away anything at the beginning of the stream, and then someone talked me into it.
Yes, one thing. Good night.
That's not how Paul does it. So I really liked talking with Dr. Rita. I really liked your style, so that was cool to.
Yeah, she was cool how she would get fired up. Like you can tell, like she's very passionate about this. 40 years, no vacation. That's strong. That's
But
like
she
not
also,
a day off.
yeah, she's come here to visit us.
Yeah, that's pretty cool. Yeah, we definitely want to have her on again to talk about. It doesn't even have to be like obviously this is kind of like the intro of her to our audience, but it doesn't have to be necessarily even Corona talk. We can just talk about how to be healthy and making better life decisions. So that's pretty cool.
Totally.
So if you guys want to call in, we've got our phone number here. It's 480-519-4999. Just go ahead and give us a ring. If you have anything you want to share with us, if you want to be world famous, to 128 people watching live. We usually get a couple thousand views, so you can come on the phone and stutter, and I'll interview you.
Well, the also I do want to play that clip as well.
Right.
So that's like a 10-minute clip. So I don't know if we're going to be doing that later.
Let's just go to it. You want to?
Yeah, I do want to play it though.
Let's
We don't
watch
have to play
Mrs.
the whole thing in one shot.
Mrs.
either.
McMurtry. Let's just go ahead and watch that real quick.
You want to go back to hers?
Yeah, why not? People might not have seen it, and it's good stuff anyway. So
Okay.
we like
All
it.
right, we'll tee it up, man.
Me?
Yeah.
Okay, so Mrs. McMurtry, you guys may know her as the better half of Pastor Tommy McMurtry, as they say. And they just celebrated, I think they're like their 19th wedding anniversary, and he's the pastor of Liberty Baptist Church in Rock Falls, Illinois. And there's no waterfalls in Rock Falls, Illinois.
Oh, she's live right now.
She's live right now, so she's not going to. She's doing some kind of giveaway, but she's not going to be calling us. She doesn't know we're doing this, but let's just go ahead and
Yeah, let's roll
play
it.
that video.
All right, guys, here it is. Awesome. I love that video. They did a great job on that video. I really appreciate them letting me play it here.
They won't give you a copyright strike.
No,
you don't know what's going to happen with these other folks. What's this other video? Is it the news?
Yeah. No, it's just body cam footage. So I think we're good on this next clip as well. But it's so true what they said, because the numbers: 56,000 people have died in America. That's it. 56,000 people. More people die of the flu every year, people, and we don't lock down the country.
Those numbers are highly inflated too.
Exactly.
They're already admitting.
Yeah.
Before, they always
exactly.
do they always do it years later. Oh, it wasn't as bad as we originally thought. But in the middle of it, they're downplaying.
Yeah. And going along with this shutdown is just, that's the problem, is no one's standing up against these people. And so I really appreciate the few that are going to all the rallies around the states and protesting and trying to get this lockdown ended.
I disagree. I think the way we protest is we just do what we want to do, and we shake people's hands.
Exactly.
And we go in and we close that 6 foot distance.
I have refused to change any element of my life. I go to work. I go out to the store. I don't wear gloves. I don't wear masks. I don't do anything different. I'm fine.
I ride in the HOV lane because I got because but no, seriously. But people are out there. There was traffic today. Not as bad as it was back in the good old days when people were, I don't know, these are pretty good. But before this all went down, there would be traffic. And there were certain parts of town where you knew after this time, it's going to take you longer to get there. But we haven't had any of that. But I noticed that cars were a little more dense on the road today. So I hope that people are just we don't have to go out there and thumb our noses or whatever they say to a bunch of politicians who cares about them anyway. I really don't care about what they do anymore. When they say they've made this law or that law, I don't care. But just to go about, like you said, and just go do your normal thing. And I think that's where the real courage is in front of your neighbors, where you're like, hey, we're having a birthday party. You guys want to hang out? And I think that's the problem. It's the fact that we're not afraid. I'm not afraid of the police. I'm more afraid of my neighbors. I just moved into a new neighborhood, and we're gonna have a little birthday party, but we decided not to be jerks when we don't even know our neighbors, and then we'd have a brand against us. So,
well, I appreciate Orange Blood in the chat. He just bumped his monthly Patreon for $5. I appreciate that, man.
There he goes. I hope he wins the prize of his.
Yeah.
What his heart
and
desires.
Also, I just wanted to let people know that we have pulled the trigger on our 10th film. It's happening. Logan's coming with us. And so the tickets have been purchased. We are traveling abroad.
Overseas.
So
if you have to get the vaccination to do it?
Are we talking about where we're going?
We're not talking about.
I don't even know, and you're not allowed to.
Yeah. So, if you guys don't know what we're talking about, I'm in the process of making my 10th film. And so, if you go to the website, you can check out the 10th film. It's like a secret project film. The reason why it's kind of top secret is because we don't want to ruin our chances to get powerful interviews. And so, we need to fly over there under the radar, get good interviews, and then come back. But I got Logan's ticket bought, my ticket's bought, and so I really appreciate everyone supporting that film. If you haven't yet supported that film, please consider donating to that project, and if you do, you'll be entered in for the drawing.
Right. So what's this video you got queued up here, Paul? You want to wait for Logan to get back from
no, we don't have to wait for him. It's a long video.
Okay, but we need to probably talk over it and maybe, I don't know.
No, because it's a body cam footage. It's fine.
Let's let it ride and see what they do.
It's a great video, guys, because it shows what this is doing to small businesses. Shutting down the economy it hurts a lot of people. And so we're going to play this. And if you want to stop it, Dustin, we can stop at any time. The sound is pretty bad. It is police cam footage. And so the sound is pretty bad. It gets pretty loud at certain times, and then it gets really quiet. So we'll try to do our best to control the sound over on this end, but sorry about that, guys. But what it's the video itself is very important. So let's go to it.
How are you doing?
Hi,
Can you
how are
open
you?
today?
Absolutely.
Okay. I believe you have already been given a warning about being open, not being open.
I'm in compliance, sir.
How are you in compliance?
I went and I changed my license. I'm not just a souvenir store now.
Okay.
I am a department store. Indian department store. I am
So you
handling
changed your
hay. I am handling hay. I am handling paper towels, food, dog food. I'm starting. I'm getting a bunch of new stuff.
What kind of food are you handling? Snickers,
kind?
Twix, Musketeers?
Yeah, anything. And so I'm in compliance. I'm legal, and I have a right to be in business handling these other products. I'm just getting prepared to get a big load of hay. I got hay over here. I got people coming in to buy it. I'm in compliance. Thank you.
Okay. Can I see your license real quick?
Huh?
Can I see your license?
Sure.
I don't want you to feel like we're harassing you or anything.
No, but you are.
How?
Because I already talked to the police yesterday. They talked to you about it. Didn't they say anything to you about it?
Nope,
Yeah, that's why we're here.
not
Huh?
to me.
That's why
To my
we're here.
supervisor.
Well,
It's because they told us you were reopened after you were told not to be.
no. I
When
changed
did
my...
this change?
Huh?
When did you get this
It
changed?
doesn't matter when I got it.
But it kind of does.
It doesn't.
So he was trying to wave around his tax license saying he's now a department store. Issue date was
It's the
3/20.
law, man. I can.
I know.
So it says
I
issue
can be in business.
3/24. So,
How's business been though,
Okay.
overall?
It's dead, man.
all right, we will
You
get it
guys
taken
are,
care of. Thanks.
government's killing everything.
So,
I get 1 or 2 people a day. Corona Bologna. And look at all the
I
people
love
over
that when
there.
he
Look
says
at all the
that.
people, everywhere.
We need to start selling this t-shirt.
well, unfortunately, you are getting a citation. I need to
I
take a
don't care.
picture of that. I need to take a picture of that. And I need
It's
to
just,
write it.
it's just documentation. It'll
So
be
he's
all
gonna
right.
give
Do
him
you
a
have your driver's license
citation?
on you?
Ridiculous. I wonder how much that
I'm not
do.
driving.
Okay. Tell you
I
what,
don't.
go ahead and arrest him, put him in handcuffs, and then a search and search. So let's get your hands out.
What are you going to arrest me for?
Because you're failing to identify yourself. So that's enough.
Identify myself. It's on my thing.
No, it's not. There's
Here,
your name on it.
I'll give you my license.
No, you're already in cuffs. It's already a
And
done
you
deal.
guys are going to be in trouble.
No,
I'm going to sue you.
that's fine.
Go
Hang
ahead,
on,
step
don't take
outside.
him out. Check his ID.
You're arresting me.
So if you would have just given me your ID,
I was just going to give it.
No,
But
you
you don't
weren't.
have a right in my store to come in and take them. You don't even have a right to come in there.
no, well I do because you're
Well,
open to
if
the
you're
public.
open for business, we have that right.
And so I,
Go and step right here. Spread your
I mean, this is just ridiculous.
Well, yeah, I would
I mean-
say you're trespassing.
I love the when he's like, you don't think we're harassing you, do you? He's like, well, yeah.
Yeah.
He's like, well, how? What do you mean we're harassing? It's like, you're
What's up?
here. Are you here in my store bothering me?
Yeah,
That's
you're not
harassing.
buying it.
Like,
Buy
hello.
something
It's a
to get
power
out.
trip because
Yeah,
I
it's a
mean,
total power
he
trip.
said, "Oh, I can I see your ID?" And he's like, "Well, it's right there in my paper." And he's like, "You're arrested." It's like, what in the world?
Right.
It's crazy.
You should just tell him your name. You say, I don't have to give you my license. It's just, here's my name, my full legal name.
Yeah. Well, anyways.
What it was, they were asking for the business license. They wanted to see that, like, he made some change,
Yeah.
to be a department store now.
Basically, what the guy did is he got some hay and some
Some
toilet
Snickers,
paper.
did it
water,
right.
toilet paper, yeah.
That's what happened.
What more do you need?
But that's
What more
what
do you-
he's
yeah.
in compliance, though.
Yeah.
Like, what in the world?
Yeah, so, did you hear about those people up in Idaho where they, like, some cop arrested,
I don't know. Look
The
that
mo-
up.
Is it the mom in the park?
Yeah,
Yeah.
we played that
Do
on
you
our
see
earlier
what's
show.
happening now?
We played
Where
no.
they're all the people in that neighborhood, because it's a small town, Idaho's, there's no,
there's nothing happening.
Not going a lot, like there's the little cities.
Yeah.
So everyone knows each other. So they went to the cop, they arrested this lady, and they all protesting in front of the guy's house. Yeah, like, we know who you are. You're like, you're a jerk for doing this. You shouldn't have done that.
Well, while you find that video, Dustin, we're gonna finish.
Well, they're probably not yet. Go ahead.
We're gonna finish playing this.
I say, come take the money, will you? These guys, I don't trust these guys.
No, we're not going to take your
And my
money.
wallet. Get a picture of all this.
I just need your driver's license. That's it.
So all we ask for is your identification and your attitude about I'm not driving.
No, you guys are violating me, man.
No.
You don't have a
you want
right
her
to
to
even
take this
touch
cash?
me. You don't even have a right to touch me.
Do you want her to take this cash, or do you want it to go with
You
you?
don't have a right to touch me.
Do you want this cash to go with you?
Give it to her.
Okay, ma'am.
And give her my wallet, too.
I will, as soon as I pull your ID out of it.
And where will you be?
And you don't have a right to get my wallet. Do you have a way?
Go down to
It's
the
called a
department.
search
He'll
incident
be
to arrest. The
released,
Supreme
cited,
Court
released.
authorizes that.
If he would have
Go
just
ahead and
given
have
us
a
his
seat,
ID
Because I don't give you an
for
ID.
this, so under
You're under
Arizona
arrest
revised
because you're in
statutes, if he
violation of
fails to
the
identify himself, that's an
healthcare code.
arrestable offense.
That's the
You
misdemeanor.
guys are a joke, man.
Sorry you feel that way,
All I
Mr.
needed
So
was
sad.
all I
Liaison.
needed was his
Go ahead and have a
driver's
seat,
license, and that was it.
If he'd have given
I
us
gave
You
it.
know what?
Do you see that how they're both contradicting each other? One guy is saying that he's arresting him because he's in violation of the ordinance. The other guy is saying, "Oh, all he had to do is give me his license, and we would have let him go." So like they don't, both of them have, can't get on the same page. And the one guy, oh man, like it just irks me, like how he's like, I don't need any attitude about this and that. It's like you're putting him in handcuffs into the back of the car, like he can give you all the attitude he wants to get.
What needs to happen is the problem is that people just don't stand together. I mean, I'm not here. You can go to my screen here. This is the people going.
Is that the officer's house?
Yeah.
No way.
So the people need to stand together.
Oh.
Yeah, that's
and
how
they
it
go
goes,
to the police officer's house.
This is so great.
Because one of the things that happens is that people don't understand the whole corporatocracy of what's happened in America, where the police officers, they are employees of a corporation, so they have corporate bylaws and stuff like that. You would think that they're part of the government or they're appointed, but there's like corporate fronts through all these things. So these people they're hiding behind the corporate fiction of the police department and so on and so forth. And what happens is you have to call the people out personally. And you're going to say, you know what, I'm going to hold you, Officer Bob Jones or whatever. I'm going to hold you accountable, and you are personally liable, and I'm going to sue you personally. And so that's the thing, is these people, they hide behind their department and their badge, but what we really need to do is you need to go and say, hey, you're the one liable for the actions that you're taking, and I'm going to come after you personally. Of course, it's hard to find a lawyer who would do that, who would actually try to bring charges, but that's where the power is when you take it to them personally.
And this video that he just played of the cops, the people in front of the cop's house, that was a different video. That was of a woman getting arrested in a park, right?
Yeah. So in Idaho, the story is, long story short, is that some mother was arrested in the park with her kids. Long story short, and so people went to the cop's house and said, "Hey, you're a big jerk here." I wonder who that guy is. The guy, he looks like to be organizing it.
Yeah, that's the guy. That's the arresting officer.
Rewind it real quick.
Well, no, it's going to play through. So that's who they went to this guy's house and arrested.
Yeah.
I think you're right. Like, you can't hide behind the veil of, well, I'm an officer, I'm just doing my job. It's like, no, man, like, we all live together. We all have to function as society. We go to the same stores and the same restaurants. Like, you're not just you can't get away like, oh, that's just my job, but I'm John, your neighbor tonight. It's like, no, man, that was a jerk move you did. You shouldn't have done that.
Yeah.
And we're going to let you know that we're not cool anymore.
Right. Yeah. I wish. Yeah. And that's kind of where it needs to go. I mean,
yeah, we're not talking about like going in and getting pitchforks and like hurting the guy.
What?
But well, maybe not.
I mean, pitchforks would be perfect.
You can like verbally. I think it's
Torches,
it's perfect what those people did. They stood in front of his house like, hey, this is not cool. What happened here?
Yeah.
This is not the kind of town that we want to live in, and we don't want our police acting like this. That's the perfect way to handle that.
Yeah. And what are you gonna do? Go if you went to City Hall and complained to the mayor?
Yeah, they're not going to care. The mayor's not going to care. You're going to get some kind of rep like, "Oh, we are so sorry you felt that way."
Yeah, I'm
blah,
making
blah,
a public
blah.
statement.
Yeah, they're going to take your paperwork.
Well, that's what they were saying. These were orders from the mayor with that old guy getting arrested.
Uh-huh.
He was saying that these were orders from the mayor, and it wasn't Payson. I kept saying Payson. What was the name of the city?
Winslow.
It's Winslow.
Yep.
Well, let's finish this off.
You guys, he can set you free.
Oh, absolutely.
Take a seat, please.
Okay, I
got a bad knee or something?
I got two hips, replaced,
I will help you.
and my arm has a you don't have any reason to touch me.
Well, yes, I do, because you're in
Mr.
now.
Maison, have a seat.
Please.
No, you guys don't have a right to touch me or even handle me.
Oh, absolutely we do. You are
No,
under
you don't.
arrest.
Just be compliant, but I would just be calling it all kinds of names and purpose.
Okay.
Are we all right with
Yes,
this?
sir.
Are we all
He's
right
not
with
going
this?
anywhere. either.
I'm just doing my job.
Yeah, this job.
He's
this
getting
job,
released
you're
from the scene
violating
as
my
soon as we issue the
No, I'm not.
citation.
Yes, you
Okay,
are.
so go on.
Okay,
What do
we're
you
not
want your
taking
wife
him
to
anywhere.
have? Do you want your cell phone so she can come pick you up?
It's just,
Okay, and she can have the rest?
Yeah.
Okay.
Retired, it's a mom and pop store. Nobody's coming in.
right, I understand that. And you have the two different stores, right? Or does he?
The people who don't think this is a big deal, it's just it's a little insane.
Diversified.
Because this is what it's creating.
I wonder what percentage of police officers
He's
are
already been
total
told that
bag.
snacks doesn't count as grocery.
They just act like
I have your phone right here, okay?
No.
Yeah, it's just sitting right here.
His license was issued before he was already, because his license was issued on 24th. Okay, today's the 11th. He was told on the 10th he is non-essential and shouldn't be open. So even since that has been issued, he has been warned and told not to be open. And so he's open, and so now he's getting the citation for it.
Just ridiculous. Ridiculous.
Hey, so he didn't like that. He
Now he's on
He
the
was very
phone
upset.
with his boss.
refusing to give us his ID. So I basically had Johnson restrain him and then take him to the car. Search incident to arrest. I was able to retrieve his wallet from his back pocket, pulled his ID out. So we're going to give him his ticket so I can release him from here.
he should get some kind of
When we
legal.
leave-
There should be. You know, I used to want to be a lawyer.
I have a feeling
I
he's
wish I
gonna
kind
stay
of
open.
had. If I were to do it
How
over
long
again,
should we give him
I might be a lawyer
I mean,
and just
technically he should
totally go after
close
these
up
types
shop
of
as
people.
soon as we let him out of the car.
Where are the guys that would wanted to be a lawyer? It's like the doctors. You got the doctors who
should
are
I
like,
just
hey,
tell
you know what?
him
I actually want people to be
stay closed?
healthy. You know, and there's police officers out there who are like, hey, I want to keep the people
Just
safe.
let him know.
I want to make sure everybody's kind of just getting along without any trouble in my town.
As much as he may not like it, this is law. His only recourse would be to maybe attend elections and hope somebody else can get elected. I don't know. Maybe not even tell him that.
This is just civil, right?
It is a criminal. It is a misdemeanor.
It's a criminal.
Just let him know that
I really hope he fights this and wins.
this is an order
I hope
from
those
the
cops
mayor
get the Corona
or from the
virus.
governor through the mayor that he is considered non-essential and should not be open. And if we
Followed up with the mayor.
keep coming back
Yeah,
and we see
so
him
he
open,
said
he's going to get
followed
another
up with the
ticket.
mayor.
And also, he runs the risk of getting his business license
Now, this is the
revoked
key.
by the city.
Now-
And he won't be able to open at all.
So if he stays open, not only we get the fines, but he'll get his business license revoked from the city. That's
what
the
it is.
key.
We don't make the law, we just follow it.
We don't make the law, we just follow it.
You know,
All right, Mr. Mazar, go ahead and step out.
Now he's taking him back out. This old guy. Like, why do you have to put him in the car?
Thank you.
Like, why do you have to have his
What's up over here,
cuffs
please?
in the back? Why can't you put him in the front?
Okay, he's saying
Well,
what's
he
up
wasn't even under arrest. Like they just put him in there to
Yeah.
hold him,
Yeah.
like just for
Like,
like the
he's so
shame
dangerous.
of
Yeah, it's just
cuffing him
shame.
and
It's
putting him in the car. They couldn't just
control.
write the citation.
Yeah.
Like, here you go. Here's your day in court.
It's just a control.
We're not the ones who make the law.
We're not the
Yeah,
ones.
but this
they'd be bleeping. If this was me, you know, I'm a
Right, it would
Christian.
be bad.
I would just be like, you know, they'd be showing this. I'm
Listen to what
like,
he
Governor
said.
they'd be bleeping
has ruled
the
your
F
business
word that I'd be throwing at them, and it wouldn't just be the
Okay.
bad
I
F
sell
word.
hay.
It'd
They
be just
say
the
that
bad
can-
word.
I don't
No, my
determine.
business is essential.
I don't determine what's essential and what's not. I just follow the law, okay?
You're not following.
So what I did was
Listen
I
to
decided you for being open. Okay, I didn't give you failure to ID, which is a charge I could have gave you, but I didn't.
Oh,
Okay,
you're so
but
lucky.
if you remain open you're going to be continue to get cited, okay? And there's a chance that you can lose your business. So I'm trying to help you out by letting you know you're not supposed to be open.
You can lose your job too.
That's fine. If that's what you want to pursue, then by all means. Okay? So what I need right now is just your signature on that black X.
It's criminal?
Yes, it's a class 3 misdemeanor.
Why?
Class 3.
I don't know. I don't make
That's
the
how
law.
it's been deemed as a misdemeanor.
That's not the worst mistake.
Press hard. There's 5
Yeah,
copies.
but it's still.
Actually, I don't know. It's class 1.
Well, I'm not agreeing to this.
Yeah.
No, you
Yeah,
don't
the
sign.
lower the
No,
number,
I
the
just
higher
need your
the
signature. You can fight this out in court.
Signature, you're not admitting
May
that
9th,
you're
you're not admitting that you were open.
Class 3
Okay.
is like not that big of a deal. Somebody's
So I
calling
just need
in.
your signature.
Yeah, but
and you
we'll
can
keep
go,
listening while he screens it.
explain
Okay.
how you're essential to Judge Little.
I would sign Officer Jones
town?
as a
Yes.
fag.
So right here it gives you the address
I would
and
answer
the
that.
phone number if you wish to
That makes
contact
it
them.
Because
Here's
you
your
kind of
copy.
have to walk the
Okay.
line, like
And you guys
to
have
know
violated
when
me.
you're doing something that breaks the law,
You know,
and
I know you're trying to do your job.
Absolutely.
not do
but-
that.
It's a violation of the Constitution. It's a violation of our laws.
But it's
You
not.
come back there and grabbing me without my permission.
I don't
That's
need your
unlawful.
permission because
No.
when I
You're
came in
under
there, we were conducting an investigation as to why you were open. So if you were failing to give me your identification during an investigation, I have the right to place you under arrest for failure to ID yourself.
Hey, Dustin, we have Dave from Kansas that wanted to call in and talk to us about what we're watching right now.
What's up, Dave?
Hey, Dustin. Hey, nice to talk to you. Listen, I was watching this, and it just kind of disgusts me what I'm seeing on the screen here with these officers totally just going overboard on this business owner when he's opened his store, sure, and maybe he's, cut some corners and, gamed the system a little bit with his toilet paper and his Snickers bars. But at the same time, he doesn't have a gun to anyone's head saying, you must come to my store and
Exactly.
risk exposure to the virus.
Exactly. Like if
Yeah,
people
and-
want to stay home in their house and be scared, that's their right. They can do that. But demanding everyone to do that is where I have a problem.
Right. Yeah, and I agree. And it's just like the churches. There's some churches in our movement whose pastors have decided it's a good thing, to take a step back a little bit. And there's others who the doors are just open. And, either way, I see the benefits there, but because the same principle applies, none of these pastors are forcing their congregants to come to church, right?
No.
They're-
What part of
it's
Kansas
not
are
like-
you?
I'm in the Kansas City area.
All right.
Yeah. And I was glad to see the video of the folks outside the officer's house. I love it when things like this gain traction online and kind of result in a little bit of civil disobedience there. But one thing I didn't like about that is that the person who was filmed straight up and down, like vertical video.
Yeah, don't even
So a
get me
little
started on
PSA.
yeah.
Don't get Paul started. Don't get him started.
So short PSA on vertical video
Yeah,
syndrome.
stop vertical
If you're filming
video.
with a cell
No one
phone.
wants to see that.
Exactly. Yeah, our eyes are arrayed horizontally in our head, not one over the top of the other. So,
Thank you.
anyway, but I really enjoy what you guys are doing. Been watching the live streams, and when I saw what was going on tonight, I just had to call in, and it's just so ridiculous, and these body cams, I don't know if you saw, but like up in the top right corner of the police video, there's a little logo and it says Axon Body Cams. I think sometimes that the officers know that they're being recorded, or all of their interactions are being recorded.
Yeah, they turn it
And so
off
they-
and
they-
on, so.
Yeah, they just have to save face sometimes. Like the time, the era pre-body cam, they may use their discretion, right? But when they know that everything they do is being recorded, and using their discretion might make them look bad. So what do? They put that guy in handcuffs. They put him in the back of the car, let him sweat it out for 5 minutes. And then they try to walk it back, after they let him out.
Well, the interesting thing that
yeah.
someone said in the chat was they placed him under the arrest and then put him in the car. But I know we were talking and stuff. Did anybody hear him his rights read to him?
No.
Like,
But
he
wasn't arrested.
They said we're placing you under arrest, and they put him in cuffs and put him in the car.
You're right, they didn't.
So when are you supposed to get your rights read?
So that's why there needs to be a lawyer involved, because there's certain things in the case that the lawyer is going to know is the linchpin. So it would be good to have a good lawyer and to go after him, but it's going to cost more than $5,000 to even just to go there, and then they're gonna go, and then they're gonna plea bargain them, and then the lawyer's probably.
Right.
You need a ballsy lawyer. Is there a person like that that's not a grabbler, that would
I'm sure
serve the
there is.
people? I mean, that's what we need in society: doctors that tell you how to be healthy, and lawyers that actually go after the people who are who need to be responsible for violating people's rights. Because there's other rights than I think just because one person's life can be changed. Like, one person can, if there was an actual lawyer who wasn't just trying to play their client and the attorneys. So.
Right. And, some of these officers, obviously, there's always the argument they're trying to do their job, and, if they could make money doing something else, they would. But, they're pretty low on the totem pole, and they don't really, you can't expect them to know all the laws and all the inner workings of it, how everything works. And, when they're emboldened in that situation, when they have their partner there and, adrenaline gets running, it's really not going to work out well for people who are arguing with him, in my opinion. The kind of a soft answer turneth away wrath type of thing, right? So if you're in that situation and you're standing up to the law, maybe there's blame on both sides there.
Well,
Well, I thought he handled himself perfectly.
Yeah, what are you supposed to do?
Yeah, what are you supposed to do? He's being kind, but yet he's saying you're violating my rights at the same time.
Yeah, I always think it's funny when it's they can't know all the laws and remember exactly what it is. But that is exactly what we are required to do as citizens. That ignorance is not an excuse of the law. Like, you have to know exactly. It does not matter.
Yeah.
If you don't know it or not, you are still in trouble, and So it's so funny how we're held to a different standard, but they're the ones with all the training and the background in it.
And then if you happen to know what the stop and identify statutes are in your state, then all of a sudden you're some lawyer, right? And they come down on you like, oh, you got a law degree?
Yeah, they
in Arizona.
mock you, like, oh, this isn't Law and Order. I don't know what you've been watching on TV.
Yeah.
It's like, come on, man.
Arizona, you don't have to give your driver's license if you're not driving. You just have to give them your full legal name. So we've already been through this. Go back to Framing the World Live. We did a whole live stream
very
on that.
well what that is.
And so that's why I've decided I'm just going to give you a full legal name, and I'm going to call you faggot for the rest of the time. Because they probably are. Sorry, but a lot of them.
Well, thanks for calling in, man. I appreciate it. Any final thoughts?
Yeah, I would just say, when we're out soul winning or anything like this, when we have a citizen police encounter, of course, stand up for your rights. But I would say, I try to imagine myself in that situation. If I actually get, put to the ground or turned around and put the cuffs on or whatever, that time is probably not the time to argue your legal theories.
Right. Yeah.
We ought to probably let it play out in court, because tensions are running high at that point.
Okay, so let me give you my advice. If you're out soul winning and doing all that, if the cops are coming, get out of there. You don't have to. You don't have to have a high noon showdown with some cop.
That's good.
If the cops are coming, just get out of there. There's no need
to
move
on to some other neighborhood.
But the thing is, the cops came to this guy.
Yeah.
So the fact that that he was there, and so the thing is, the reason the cops were there because they were there the day before, and they didn't arrest him the day before. They just said, hey, you can't be doing this, and he probably said okay or whatever, and then he took it over to wherever you get that license and rezoned himself and picked up some toilet paper and ordered some hay and got it, went to Costco and he got himself a case of Twix, and he said, hey, you know what? Now I'm essential, and that was brilliant.
Well,
and then
I'm sure he's not a loaded man, so he probably got what he could afford as well.
Well, it doesn't even matter, because all it says is he's within the letter of the law.
Yeah.
And then so these faggots show up again in their uniform, and they didn't like the fact that he
always brings it
outsmarted
back
them.
to that.
Because they're acting like little faggots. That's why. I mean, whether they're sodomites or not, they're still acting like faggots. So
pretty gay. It looks
yeah,
pretty
it's
gay.
totally gay.
It's totally gay.
They probably like look at each other when they're working out.
All right,
fags, right? So,
Does anyone else want to just like?
I'm
take
on
their-
a rant.
Okay, go do your thing.
Good
Dustin.
grief! I would mute you. So, listen. So, they came and he said, "I'm just going to be rezoned, and so therefore, I got my toilet paper, I got my Twix, I got my hay, I've got the license." And then they just didn't like the fact that he beat them. And
right.
so,
That's what other businesses are doing to keep successful in this time. They're being flexible, right? You know, like the grocery stores I'm going to, they're putting up plexiglass. You know, restaurants are putting in drive-through windows and things like that. It seems like businesses who've been flexible like that during this time have been successful, and others who haven't are not. And he's just trying to be flexible, right? He got his zoning redone or whatever, and then they still come and harass him.
And then so they came and they were harassing him, and then the guy's like, you know, he's like David standing up against the Goliath, which are just two allegedly homosexual police officers, and you know they're coming
Allegedly?
I mean, we don't
alleging.
know they're not. That's all. I'm saying.
Yeah, they don't know they're not. No, and they probably they work out together, and so what I'm saying is that they show up, and he's just like, I've got my rezoning, I got it. Look. And they're like, yeah, that's not enough. He's expecting them to go away. And then he realizes that he's in over his head because now he's dealing with a bunch of queer bullies. Because there's nothing worse than queer bullies. And so they're like, yeah, that's not going to work for us. And so, you know, he was clearly bullied. And, you know, so they cited him for that. And I think he's got himself a case. So that's my final answer.
I'm going to watch this one and see how it plays out. Well, God bless you guys. Thanks for everything you're doing.
Appreciate it.
Thanks for calling, David.
All right, thanks.
Thank you so much.
Appreciate the call.
All right, guys, make sure you subscribe and support us on Patreon. $1 a month, you'll be entered in for a chance to win some DMSO, some toothbrush, some POH toothbrush, the best toothbrush ever, some a citrus peeler. We're also giving away a Fluoride Poison on Tap DVD and a Fluoride Poison on Tap t-shirt. Now, this is a small, but you can obviously, if you win this, you can give any size you want. And also, the Don't Tread on Us CD. This is Gianluca Zanna. Don't Tread on Us. We're giving that away as well at the end of the stream. So if you want to be entered in for a chance to win, all you have to do is increase your Patreon level by $1 or order anything from Framing the World. And not only that, you'll be also get a chance to win some Orion sunglasses. So we're going to give those away on our Saturday stream if we have one. Yeah, I think those are the... Ooh. So there's a bunch of different styles and varieties of the Orion glasses, and that's one of them that we're going to be giving away at the end of the week. So I appreciate everyone's support. I appreciate everyone listening to this live stream and tuning in. But I do want to play the rest of that video, and then we'll move on here.
The only thing I can tell you is the direction we were given is issue citation. If you continue to remain open as we drive through town and we see you open, it's another citation. It's another citation every time we drive by and we see you. Eventually, you will just end up going to Holbrook. There will be no more cite and release. It will be, you can go sit in jail for 24, 48 hours. The reason we're not now is because I have no reason to subject you to a county jail for this. Okay. The mayor is looking into businesses. The mayor is because his proclamation under the governor, which is authorized by our state constitution.
We're going to vote him out.
You know what? I'm not allowed to talk politics at work.
I know, but I'm telling you, this is a violation.
Every mayor is going to have to follow this.
I showed him
Could
my
you just
license.
leave at this point? Like, he'd be like, I don't want to listen to
You
you.
did, and I took a picture of it, and it will be included with this report.
So, see, that's the thing. I showed you a legal license. Now, the law says I can sell this, and I can sell anything else along with it. Okay, this is the law.
Your
You're
license was
violating
issued-
the law.
Let me finish.
Yeah, but my license is violated.
So the license
Just because it says to close, they didn't even look at my license.
So, but you don't qualify.
I do qualify.
Well,
I am a
according-
department store.
Well, you're really not.
Yes, I am. I have the
According to
stuff there.
Hello.
I have the hay out there. I'm selling hay.
Regardless of what's going on.
Yes, it does.
So,
See,
I have a question.
you violated me.
My adult children.
I'm sorry you feel that way.
Professionals
You
over in
did?
Prescott.
I mean, it's right there. Department store. You can handle any
Is this
product.
sequential?
Why are you
And
guys
did they go
inviting
back?
to 6
So I ended up cutting a bunch out because it's a really long video.
Yeah.
That's not a.
So I
That's
So
not
they
a-
follow him back in. I'd be like, get out.
Why is the marijuana shop considered essential?
It's no longer a marijuana shop. They closed. It's just a grow house.
Come arrest
It's a
me
what?
for running a business, trying to make a living.
Growing
Pay
marijuana.
So they're no
taxes,
longer
pay
open
your fee,
for,
your
know-
wages. And then,
Like I said, like I told him, we don't make the law.
I
They're
have
just
no.
trying to enforce, and there's a lot of
no
chaos
authority
and
over it.
confusion. The real
Exactly.
issue is
you
Jesus
don't
is
have
the
any understanding of the law either.
We
You're
all
not a
need to
lawyer, and you
learn
didn't have a right to arrest me.
Well, we did.
There's a couple elderly people who
I
need
know
to
better.
make a
I've been
living.
around a long time.
That's
No, I
why he is
understand.
diversifying to the
I've been
best of
through
our
legal
financial
things.
ability.
I understand you guys need to make
Adding
a living.
food
That's
and
why
More
I'm
than
doing
one
this.
way.
I have to
products
make
so
a
he can
living.
stay open.
No.
Yes, you did.
I would just keep saying the whole time. I can't understand what you're saying. What are you saying? Like you take that stupid mask off your face. I can't.
Yeah.
What are you saying? What? Because even in the video, you're saying, he's like, well, I'm just trying to tell
Yeah, but you notice how he doesn't even have it over his nose. It's just over his mouth.
I'm sorry I feel that way, sir.
All right.
All right. Do we have anybody? Let's give away something. Okay.
Okay.
You want to give away something away?
Well, yeah, let's give it away some.
Okay.
So hold on.
Let's spin the wheel.
Wait, hold on. So let's give away citrus peeler.
Okay.
So wait, hold on. Let me go to your.
Yeah,
okay.
you ready for it?
So why don't you read off the names here?
All right. We got Nathan, Crystal, Moises, Sheila, Crystal again, Anthony, Milan, Ninja, Rod, and Casey. You ready?
Okay. Yeah, let's do it. So this will be for the citrus peeler,
Hey,
guys.
can you my computer so you can get the effect of the?
Oh, do you have the sound
I
effect?
think there's
on
a
it?
click.
What? What? Oh wow, this is a long wheel.
15 seconds. What do we want? Crystal! Congratulations, Crystal. Exactly what you wanted. I'm sure it was. The citrus peeler. Can't find it anywhere.
Dude, this citrus peeler
Not sold in
is
stores.
awesome. Yeah. Don't go anywhere without it. You want to do another one?
Oh, let's see if anyone times it. Yeah, you want to do one more?
Let's do the POH. Okay, we're going to be giving away the POH toothbrush right now.
Do you want me to tone down the clicks? Or are you okay with it?
No, you're good. You're good.
Okay, ready?
Are you writing this down?
Oh, yeah, I should probably write something down, huh?
Yeah. And you erase that last name?
No, she's still in the drawing.
No, you got to erase them.
I'll just do it if she wins.
Nathan W. All right, Nathan. Congratulations. You won the POH toothbrush. This toothbrush will change your life. It's my favorite toothbrush. All right, so you got that?
I got it. Does anybody else want to just take their kids to their local park and rip off the caution tape and have their kids play? Because I feel like that's what I'm going to do tomorrow. Right? Does anybody else want to do that?
Yeah, that sounds fun.
Just see what happens? I could care less about the weird looks from the neighbors, because I'm sure everyone else is taking their kids around going, man, I wish I could play on this playground with these kids. They're driving me crazy. They're going to see me doing it. They're going to be like, you know what? Let's all join. Let's have some fun on the playground. Let's see if anyone else is
all right.
signed
Well,
up.
we have Dustin in his glasses there, just supporting those. So if you if you don't win tonight, you're gonna still have a chance to win at the end of the week, guys.
That guy, if he just put on his sunglasses when the shop showed up.
Yeah, he would have looked way more
chilled
official.
out. Yeah,
and those are Orion official sunglasses, right?
Because
there. And those are pretty coppish.
Because the coronavirus can be transmitted if somebody coughs into your eyeballs. So you need to have. What's the plexiglass for? This is a barrier. So he would have been cool, calm, collected, and been safe against the the gyrus.
All right, so this video is almost over, guys. So we're just gonna finish out this video real quick.
I give you permission. I did not give you permission.
That is absolutely right.
That is absolutely the law. You don't even know it.
No, because my dad works for
You're a
BNSF.
police officer.
You
See, not everybody's
don't
in that
understand the law.
situation.
I know.
You
So
don't
we're
understand
trying
the
to
law.
comply
If you are committing a felony
with
misdemeanor in
essential
my
products
presence,
that
I'm
we're beginning
authorized
to
to
That's
take
not a
that.
misdemeanor. You guys are
I
out.
do.
That is a misdemeanor.
It is not. I
It's
have
so
my
unrighteous.
license.
So unrighteous.
All right.
I appreciate you guys trying to do what's right, but you're doing what's wrong.
Okay, we'll see you on the 19th.
Stay closed.
They probably don't even have court. Like, right?
Yeah.
What's going on
isn't
with court? Is court
stopped right
canceled?
now? Yeah.
Let's just Google that. Is court
Right, they're letting people,
canceled?
Well, I guess
letting all the people out of the jail.
Yeah. I guess it depends on what. It just depends where you live, Dustin.
Right. Arizona district courts updated in response to the public
Well,
health
did you
guidance
guys
related
did you
to
guys hear
COVID-19.
about Las Vegas? The mayor saying that they're going to be the test city for opening, and now everyone's like bashing the mayor, saying we don't want to be the test city. Like, it's like
Yeah, can you imagine all the wicked people that run that really run
Yeah.
that town that are looking at her like, you better get these people back in here now. They're losing millions,
Yeah.
probably billions of dollars every day if you
Yeah.
add it all up. Like,
Pull
the
up
juice
that
is
video,
running on
Dustin.
these casinos.
What's that?
Pull up that video of the mayor in Los Angeles.
Okay, what I
Las
want to
Vegas.
know is like they don't care about all the whores that are just spreading germs all over town anyway.
Exactly. That's what's so funny. Yeah, you walk the streets of Vegas and they're like literally handing it out. Like everywhere you go, there's trying to put it in your kid's hand. I would never take my kids.
Nevada
there.
governor responds to
Don't take
Las
your kids to
Vegas
Vegas, by the
mayor's
way.
response. Watch Anderson Cooper. I can't watch him.
Yeah.
Oh, it is. Sorry.
No. Yeah. Don't watch him.
Can you do the split screen without him?
It says Eric G says Dustin looks like a sheriff.
Yeah, he does.
I would vote for Dustin for sheriff. That's my kind of sheriff.
Well, maybe that's why calling. I don't
All
think
right,
so.
maybe we should do another giveaway.
Let's
here,
do another
guys.
giveaway.
And you know what? Make sure back up just a touch.
Yeah.
Logan. Okay. All right, guys. Make sure to tune in to tomorrow's live stream. It's going to be awesome. We are going to have Mr. Death on the show tomorrow, and so Fred Leutcher. I don't know if I'm pronouncing that right. I got to figure that out. But he's the guy that invented the modern way of killing people through hanging, gas chambers, beheading, guillotines, you name it. He is the one.
We're gonna get all. It's gonna be fun. So
It's gonna be
Sean
good.
Jolly, not Sean Jolly, Brother Stu KJV. He's talking about how the whores wear masks in Las Vegas. It's gotta be bad for business.
Did no one find that video yet?
I did. It was just all Anderson Cooper.
No, there's a great video.
What's it say? Las Vegas mayor what?
Test City.
Okay. Okay, we'll see.
Do you want to do another?
Yeah, let's do
Want to do that giveaway while he's spinning that?
Here we go.
Are you ready for it?
I got it. 51 seconds.
No. We're gonna do
All right,
it.
let's do a giveaway when we'll do it.
Okay, wait. So we're
Okay.
gonna be giving away
What did you get?
the "Don't Tread on Us" CD by Luca Zanna, and it's a Framing the World, guys. This is a Framing the World record.
You
Officially.
produced it. It was
I
like
did.
it was all you.
Has it gone gold? Do you have like a gold record that you can make? Like,
He's
how
got
many do you have to sell to go gold?
He's got a gold. What do you call it? Not laser disc. What's those things? Blu-ray.
Yeah.
All right, you ready for it?
All right, let's do this. 6. Scroll down a little bit. Oh, it looks like Moses.
Moises.
Moises.
Did you spell his name wrong or something?
No, that's how it was, man. I don't make the names. I just write them.
All right, Moises, thank you so much for supporting us on Patreon. You are going to get the "Don't Tread on Us" CD. So thank you guys so much for supporting us. We still got 3 more giveaways, so we got big ones left, guys. Fluoride Poison
Saving
on
the best
tap,
for last.
Fluoride Poison on tap, and then the grand prize here, guys, DMSO. This stuff is $25, I believe. and
Giving
the
away
most
way
amazing-
too much stuff today.
Yeah, I am.
Like you gotta love Paul. Come on, show him some love on the Patreon.
on.
He's just giving the store away. He's like the guy in Winslow, just trying to give it to you guys.
I know.
Show him some love.
Paul is a department store. Did you know?
Yeah, we can have people in here,
Paul's
right?
got toilet
Let's get some-
paper.
we can sell some hay out the back.
He's selling Twix. He's got some hay.
Man.
You
All
know, you better rezone, bro.
Play your video, Dustin.
Okay. You got sound?
No, sorry. Hold on. Let me. You don't have sound, I guess.
All right, let me go ahead and that's all right, because you're a professional.
Are you
did
muted?
this. No, let me just. This is the iPad sound, so switch off the iPad.
Okay, we'll get it figured out here, guys.
It's already done. Ready?
The mayor of Las Vegas is facing criticism after she said that her city was willing to be a control group to test whether social distancing works or not. In an interview with CNN's Anderson Cooper, Mayor Carolyn Goodman said she wants the city's casinos and hotels to quickly reopen, adding she offered to let Las Vegas to be a control group, but was rebuffed by statisticians.
Have to open up. We have to go back. Our bus drivers, our
But hasn't it been
cleaners,
because of
our
social
restaurants.
distancing that the numbers have been what they are?
How do you know until we have a control group? We offer to be a control group here.
I haven't heard
And
you
we
say
have
yes, that you would be
43
sitting on those casino floors every night along with the people that you say you are holding their hands with.
What is the purpose of that? First of all, I have a family.
So that guy was.
Those glasses, man.
Anyway, so that guy was saying that he's going to reopen the city.
The city's casinos and hotels to quickly reopen, adding she
But hasn't it been because...
Yep. Yep. So Mayor Carolyn, good man.
Yeah, good man.
Dude, I'm for whatever he decides to do. He's the mayor.
All right, guys.
You want to do another giveaway?
It's not too late to get in on this, guys.
All right.
Yeah, let's do another one. Let's do the.
We gotta get out of here, man. We gotta jump ship.
Andrew's over here waiting for us, trying to get some food.
Fluoride Poison on Tap DVD. Let's do it.
Oh, you muted my sound.
I muted your sound. Sorry.
And this is for the
Fluoride Poison on Tap DVD.
Fluoride Poison on Tap.
Anthony, congratulations.
Woo!
All right.
And so let's do the T-shirt now next.
The T-shirt. Hey,
And if
did
you're
you ever get Pillar and Ground his stuff?
I'm pretty sure he's never sent me his address.
I sent it to you.
I want him to send it to me.
Does he really need this stuff? He doesn't need it.
Okay, so we're going to be giving away the Fluoride Poison on Tap shirt next, guys. I appreciate everyone that's supporting us.
Pillar, send it to live@framingtheworld.com.
Yeah, and let me know what shirt size you need, guys.
This is for the T-shirt?
Yep.
KCT, congratulations.
All right. Cool, Casey. All right, so now the mother of all prizes.
Everybody is getting their comments blocked in the thing because they mention Anderson Cooper, but then they also say fag in that thing. So I don't know if it's because they say Anderson Cooper or they're calling him a fag, but I have to authorize those comments.
Look, guys,
all those comments are authorized. Yeah.
If you guys don't have DMSO, make sure you guys go to framingtheworld.com and get some DMSO, guys. It is literally the best stuff ever.
If you brushed your teeth with DMSO with one of these toothbrushes and wearing these sunglasses, you will live forever.
Oh man, that's the best clip we've had. Too bad it's got us laughing over top of it because it's epic. All right, are we ready to do this and get out of here?
Let's get out of here, man. DMSO.
Beach ball.
It's so hot up here.
It's so hot.
It's like 100 degrees at least up here.
Ninja! Congratulations, Ninja.
All right, Ninja. Let me know how you like it, man. All right, guys. Well, I think that's it for tonight. Make sure to tune in to tomorrow's show. Logan just does not know how to mute himself. it's just like,
what do you want from me?
It's
I get my head in the thing. I gotta do. Do you want me to work on the computer, do this stuff? Then I have to come back here. You want me to talk? Not
it's
talk?
a lot of pressure.
You're doing great, Logan.
You're doing great, kid.
The glasses. All right, guys, make sure you tune into tomorrow's show with Mr. Death, Fred Leutcher. Hey, pull up the trailer. Pull up the trailer. Logan, pull up the trailer.
Okay.
Come on, one more thing. Mr. Death, Mr. Death trailer. Okay, and I want you to, just in case you didn't get this the other night, let's watch just the trailer, third one down. Okay, watch this real quick and then we'll end it, guys. Is it muted?
You can't open up the telephone book and say gas and then chamber and then experts and out come 10 Fred Leuters. No, there's nobody. Fred Leuchter was our only hope.
I don't think he's naive. I guess if the Godfather called you up and said, you got to do this job for me, you just do it without thinking about it? Come on, guys.
To me, looks like he's almost under a spell. He truly believed what he was doing was right.
He saw everything he had built up in his own quiet, humble way destroyed by these people he had never met, whom he had offended.
This guy, Joe, asked me if I knew what Fred did for a living. I said no, and he said he kills people. And that kind of surprised me until he explained exactly what he did. Which wasn't that he killed people, but he made things that killed people.
Mr. Death. So creepy. All right, guys, we're having Mr. Death on the show tomorrow at 4:45 p.m. Arizona time. Make sure you tune in to tomorrow's show. Dustin, thanks so much for doing it today, man. You did awesome.
That was fun.
Yeah, I appreciate it, guys, for tuning in, and I'm glad you guys got some good prizes. Hopefully you, everyone out there that's listening right now, give this video a thumbs up. Make sure to support me on Patreon, guys. Go to Patreon. It's just $1 a month. Support me, help me out, and we'll keep doing these shows. All right, guys.
And subscribe to Our House. I put the link in the chat.
yeah. Subscribe to Our House.
And we should put that in the link of. We should put that in the description of every video.
Yes. Okay, you got it.
So,
yeah.
God bless
Subscribe
you
to
all.
Our House.
Thanks for watching.
Peace.